Test en anglais, test en anglais, test en anglais, test en anglais, test en anglais.
Good morning, distinguished delegates, dear colleagues. We are about to start. Good morning to you all. I would like to welcome you all to our first plenary session of our 93rd General Session of the World Organization for Animal Health. During our day, we will address several important matters for the organization, including the Director General report on WOAH activities, presentation and adoption of the 8th Strategic Plan, global animal health situation, governance and financial matters, as well as the activities of the Council. I also want to remember you that during this afternoon we will also proceed with the elections for the regional commissions and related voting procedures. But before we begin, I would kindly remind delegates that quorum requirements will need to be verified at different stages throughout our day, particularly ahead of the adoption of the resolutions and the voting procedures. I thank you in advance for your active participation and cooperation during our day, and we will now proceed with the adoption of our provisional program of the 93rd General Session. And there are any comments before we proceed with the formal adoption of the provisional program? None? I see none. So the program is adopted by the Assembly, first decision that we made. So we will now proceed with the announcement of the nominations for the subcommissions for the Agenda and the Credentials Committee. For the subcommissions for the agenda, the Council has nominated Dr. Fajer Al-Saloom, Delegate of Bahrain, and Dr. Mary Van Andel, Delegate of New Zealand. And for the Credentials Committee, the Council has nominated Dr. Vilmer Juarez, Delegate of Nicaragua, and Dr. Masao Kita, Delegate of Japan. The members of this committee will also serve as auditors of the Council and as scrutineers for the elections. I would like to thank them all for supporting the work of the Assembly and contributing to the smooth conduct of our General Session. Thank you. And now I have the pleasure of inviting Dr. Emmanuelle Souberan, Director General of WOAH, to present a report on WOAH activities in 2025. Emmanuelle, please, you can have the floor. We still don't have the quorum, but we will start with the presentation.
So, dear delegates, before I begin, I would like to thank all those who contributed to this year's achievement, members of the Council, regional commissions, specialist commissions, working group, ad hoc group, and our reference centers, reference laboratory and collaborating centers. My sincere thanks go also to our financial partners for their continual support, and of course to WOAH dedicated staff across headquarters, regional and sub-regional offices. 2025 was a year of both delivery and strategy. I will first focus on our support to members and then explain how we strengthened our foundation in preparation for the next strategic cycle. So in 2025, indeed, we were focused, future-oriented and impactful. Throughout the year, we continued to use the 7th strategic plan priorities as drivers of success. These include, as you remember, scientific excellence, data governance, responding to member needs, collaboration, agility, and efficiency. At a time of growing global health challenges, WOAH stood next to members, delivering on our core missions, and major collective achievements were made possible thanks to the strong and long-standing partnership, as well as the many collaborations developed along the way. At the same time, we looked ahead, preparing the groundwork for our next strategic cycle. So let's first turn to what WOAH delivered for and with its members. In line with our mandate, we delivered 4 core types of support. First, data and information to support decision-making in animal health. Second, standards, status recognition, guidelines, and implement decisions. Third, direct support to build the capacity and capability of the members. And fourth, tools and global strategies to increase efficiency and coordination. And in parallel, we developed major communication and advocacy efforts to increase the visibility of animal health and of WOAH. At the foundation of all decisions is data, so we will go through these four important activities. At the foundation of all decisions is data and information. And as you know, evidence-based decision-making ensures that the right action is taken at the right time, by the right actors. And in animal health, solid evidence is what allows members to rapidly make decisions to prevent the spread of disease. In 2025, we strengthened not just the data we provide, but also the analysis we generate from it to help you to identify what matters and be able to act quickly. We processed 804 immediate notifications, which you will see it on Jenny's presentation on the situation worldwide, but it is an increase of 47% compared to the previous year, which is very important, as well as 5,873 follow-up reports. Here also a very important increase compared to last year. The finalization of the interoperability between WOAH and ADIS, the EU notification platform, marked also an important step towards reducing the reporting burden of members. And this is a best practice that we aim to expand further across regions to other regions. Overall, we provided greater transparency on the global animal health situation, contributing to early warning, cooperation and coordination, consistent with our leadership in animal health data. And I like to say that a lot of international organizations and partners continue to integrate our data into their own system, because it is very important for us that the data we have, we can share them openly. Beyond notifications, we also delivered analytical projects for data intelligence. These include the publication of 32 animal disease situation reports covering ASF, HPAI, wildlife diseases, and we also published statements on different diseases like FMD, LSD, New World screwworm, and so on. In 2025, we did a survey to our members, and we have with 180 respondents, which doesn't mean 180 members. The respondents were can be delegates or focal point or other veterinary services respondent. And the result shows that 88% that the people who answered are satisfied with WOAH data. This is a strong result, an indicative result, but a foundation. We see it as a foundation to go further. In the area of animal health standards, we continue to provide rigorous science-based references to guide members in applying international standards. Of course, I want here to acknowledge the very important work of the specialist commissions and all the working group and ad hoc group involved, and all the reference center, collaborating center, and reference laboratories. And I would like to draw attention to the following outputs. 97 chapters were circulated for comments in 2025. Last year, we adopted at the 92nd General Session a resolution also on vaccines, reinforcing our commitment to prevention. And since we've already started implementing action, for example, we worked on the public-private dialogue mechanism between the that is called Prevent and that we launched yesterday. We also had important outcome of our efforts. We received 23 new applications for status recognition, and 381 annual reconfirmations. And I want also to highlight the fact that regarding status, that this year we will celebrating the 30th anniversary of the status, official animal health status recognition, and we will have a small celebration, specific celebration on Friday. Also important regarding standards and particularly zoning, we organized in December a forum on zoning at the headquarters. Knowing the importance of access and digitalization, we launched a standard navigation tool, and this tool allows to search through the codes and manual. I think it's easier to search and find the information you are looking for more quickly. We also published key outputs, and I would like to draw your attention to some of them. 2 guidelines. On the first one on avian influenza for smaller holder poultry systems in resource-limited settings. The second one, which I would like to highlight, is the one on mitigating disease transmission risk at the wildlife-livestock interface to facilitate safe trade. And these guidelines, as others that were published, respond to specific needs identified by members and are the outcome of collaboration across WOAH stakeholders. I think it is very important, and we'll see it during the presentation of the 8th strategic plan, that you are able to ask us about what you need regarding standards, of course, but also guidelines, and then we can work on what are your needs. I would also like to highlight the publication of the second observatory monitoring report. This major analytical output on the implementation of standards help us understand reality on the ground and ensure that our standards remain relevant, coherent, and impactful. This version focused on some issues: trade and sanitary measures, self-declaration and official status for animal diseases, movement control and border precautions, zoning and compartmentalization, and antimicrobial use and resistance. So in this report, you can find the findings, but also the recommendation of the observatory, recommendation for WOAH, and recommendation for members. In 2025, WOAH capacity and capability building support continued to inform prevention, preparedness, investment, and standards implementation in animal health systems at member level. We activated our incident management system twice. We also conducted 50 PVS activities, and I come back to this survey that we did, that 79% report increasing investment when leverage PVS, so performance of veterinary services evaluation findings. And this showcased the impact of one of WOAH's flagship program, and I would really like to highlight this result. Among other capacity building activities, we developed e-module, reaching a total of 56 e-modules that are completely free access for you, but also for veterinary universities or other stakeholders. In December, we reached a milestone in the laboratory twinning project with 100 projects completed since the beginning, and we have 17 projects underway. And this year, last year in 2025, a new 3-year veterinary education establishment twinning project was also launched between the National Veterinary School of Toulouse in France and the National School of Veterinary Medicine of Sidi Tabet in Tunisia. I would also like to highlight, and which is not here on this slide, but the very high number of webinar, workshop with members, with focal point, so some exercises, simulation exercise that we organize at regional level in many areas, so I cannot give you a complete number for different reasons. First, because we don't have the indicators for the moment. That's an indicator that we want to build for the 8 strategic plans, but as you know, in your regions, that there has been a lot. And these were on many issues. It can be zoning, compartmentation, animal welfare, notification, AMR, biothreat reduction, and so many other topics. And for that, I also really want to thank our regional representatives and representative also of sub-regional representation. Overall, according to the same survey, 97% of members reported that WOAH respond to their needs. Although, again, it is indicative of perception, these findings are encouraging, and we will continue to work on that. In parallel, we continue to implement global strategies and initiatives. I think there is a small problem with the diaporama because it is not the right. Yes, it is not the right slide. But yes. We continue to implement global strategies and initiatives to strengthen collaboration and partnership. And we had 4 new collaborating centers, which were nominated in 2025, bringing the total to 20, and 5 new reference laboratories were approved, bringing the total to 270. And these figures demonstrate WOAH ability to rely on scientific expertise, and also the capacity of this reference laboratory and collaborating center to spread their knowledge among members at regional and global levels. You see this slide that we need to, this is the slide where you see how many reference lab and collaborating center we have. Is this collaborating center on different regions. As you can see, there is it is not very equitable coverage across region. This is something very important we need to work on. There will be some presentation by the Biological Standard Commission about what are the needs in which region. And I think we need to have a discussion about this to better, to have really a support in every region. In 2025, achievement across global strategy and initiatives were extensive, ranging across One Health, preparedness, GFTAD, aquatic and animal welfare, and I want to highlight a few of them today. So regarding transboundary animal disease, our work was both strategic and focused on delivering and ad hoc action globally and at local level as needs emerge. So what is important is that with our colleagues from FAO, we launched a GFTAD governance review. GFTAD is a mechanism that has 20 years now, so it's interesting to see how it works and how we can, with very good results, so how we can continue to have even better results. But we need to keep this mechanism. We advance on African swine fever, foot and mouth disease, peste des petits ruminants, avian influenza joint objective, as well as regional priority disease, such as lumpy skin disease, New World screwworm, and Rift Valley fever. It is impossible in 10 minutes to describe everything we did, but it is, of course, a topic that is very important for us. To reinforce global resilience through One Health, we strengthen multi-sectorial cooperation and advocacy, with WOAH providing leadership on animal health. In 2025, we hosted the annual executive meeting and contributed to the revision of the quadripartite MOU. We also advanced our work on climate change, including through engagements at the COP30. We want to be able to, we want to say, and I think it's important that animal health voice is heard also in this kind of fora, because climate change has impact on animal health, direct impact and indirect impact. There is a special side event on this topic during the general session. But it's also important to say that animal in good health is also important for mitigation of climate change. So I think we have a voice to give to this topic. We strengthen regional coordination mechanisms and scientific partnership, including through our support to the One Health high-level expert panel, and the designation of International Livestock Research Institute as WOAH first One Health collaborating center. This is also a call for our region to have a One Health collaborating center. We only have one in Africa, so I think there is maybe some partners that would be happy to provide some to propose some collaborating center on One Health in other regions. On rabies, we provided targeted support for national strategies. In addition, collaboration and coordination resulted in the donation of 1.5 million doses of vaccine to 19 members. We also made critical progress on antimicrobial resistance. We produced advocacy and technical material, highlighting the urgency of this global threat. These deliverables are aligned with our agreements made during the UN General Assembly of 2024 and Resolution 29 on vaccines. And we also begin the work on the list of priority diseases from which vaccination can reduce the use of antimicrobials, and by setting a group of international experts with different kind of expertise from the public and private sector. In 2025, we worked on security, emergency preparedness and surveillance, which was also a priority. We had the Global Conference on Biological Threat Reduction in Geneva, which was attended by 484 participants. This conference was a success and brought strong visibility to animal health in the global health security agenda, which is reflective of the urgency of the moment. We also finalized our incident management system, draft a code chapter on emergency management using a wall of hazard approach. We advanced on the development of the wildlife strategy and wildlife information system, which also you have a kiosk, and there will be a side event on this topic too. Advanced implementation of some projects, and I would like to give, for example, the Zoossurcy project, an initiative dedicated to strengthening the surveillance in wildlife of emerging and re-emerging zoonotic disease. There are many projects. I cannot name their all, but for example, in also another topic, we also advance in the PROVNA and PROVBA project, which is the use of Earth observation for vector-borne disease, which is very important, of course, nowadays. We started hosting the Secretariat of the Alliance Against Health Risk in Wildlife. And through this action, WOAHs continue to embed animal health across human health, environmental and security dimension. One of our drivers in 2025 was to act upon the recognition that to remain influential and impactful, we must be visible. So part of this effort was reflected in our communication and advocacy work. So you see here a substantial increase in our digital presence. We launched the Animal Echo. We published the first edition of the State of the World of Animal Health, and you found the second edition this year in your tote bag. And these two products help position animal health as a global public good and provide decision makers with insights. And as a result of our effort, WOAH's what we call share of voice increased from 30% to 60%, further positioning us as a leading reference in animal health. We also produced innovative communication products such as the Fever video. I don't know if you were able to watch it. It's a video explaining, it was done for the global conference on bio-threat reduction. It's a video explaining how veterinarians play a role in combating bio-threat. This video reached over 6.4 million views globally. In 2025, our efforts also went, as I said, so we delivered, but we also at the same time tried to strengthen our foundations in preparation of WOAH next strategic cycles. So as Director General, I focus on our obligations, of course, and on commitments that I made at the start of my mandate. Modernizing WOAH, enhancing WOAH's visibility, and we engage in high-level dialogue, enhance our advocacy efforts, and solidified our governance and structure to secure long-term sustainability. And I would like to say that in an increasing complex environment, our priority, if we are able to deliver on our ambitions, is bring attention to animal health challenges, to increase political engagement and investment. So as a Director General, I travel to many places to better understand the needs and the realities and to open, sustain or reinforce dialogue with key actors. I met with a lot of ministers, more than 27, senior government officials, international leaders, as well as financial partners all over the world, as well as veterinarians, students, scientists, private sectors, and of course many reference centers. And many encounters were, of course, here you have the dark green, it's the place where I went, and the light green is some minister I met. I didn't went to these countries, but I met them during different events. And many encounters were held during regional commissions, last year general session, and also to other international meeting. At the same time, we stepped our advocacy to demonstrate the value of animal health and to increase and secure financial partnership for long-term investment in both the organization and the sector. I want to highlight also the launch of the Ambassadors Dialogue Series. So recognize the importance of diplomatic engagement to reinforce dialogue with high-level authorities, as well as the whole of government dimension of animal health. So we had this meeting in February with ambassadors in Paris. And at the same time we participated, I want to thank also my Deputy Director General and who participated to a lot of global fora, and including G20, UN high-level events, and global health platform. And I hope this engagement is already translating into stronger political visibility for animal health. But it's a long journey, I have to say. Another priority in 2025 was the review of the governance. A process launched following the adoption of Resolution 12 at the 2024 General Session, done with the support of the Governance Review Committee. So you see here all colleagues that are participating to the Governance Review Committee. I will not go into detail, of course, because we have a dedicated session that will be presented by Dr. François Caillat. But I, however, take this opportunity to thank a member of the committee to their dedication and state that this work will continue to be a priority for years ahead, of course. It's a very important work. And really, I encourage all of you to support your representative of the Governance Review Committee in this very important work. We set the SEN to be operationally stronger for the next strategic cycle and sufficiently agile and efficient to deliver better for members. In doing so, we brought together strategic function to prioritize visibility, investment, and our ability to demonstrate results and downline impact. So the change is the creation of the cabinet here that we did. During 2025, as part of our commitment to digitalize and modernize WOAH, of course, we carried forward important work stream. For example, we launched the development of a human resources information system, which we still don't have in the organization, but it's now really well on good track. We rolled out a project management methodology initiatives accompanied by change management, and these two initiatives will help us reallocate resources to be more agile and efficient. We also further strengthen cybersecurity to protect WOAH data, one of our most valuable resources, and redesign the architecture of our data systems. These are the work that you don't see, of course, but that are essential. And there's a lot of work that you don't see, and I want really to highlight the important work that all our colleagues from human resources, financial colleagues, the travel people in charge also of travel, buying tickets and so on, that it's a lot of work. Everything is written in the report, which is very big. Maybe I'm not sure all of you were able to read all the report, but I really want to highlight the fact that we need, but it's true in all organizations, we need support services, and without them we cannot do anything. So often they are not recognized enough, so I would like really to do it now. Finally, 2025 was a year of projection with the development of the 8th strategic plan. We will discuss about it later. I want to emphasize one point now. This work brought together the ideas, the needs and ambitions of first and foremost members, but also stakeholders that we included in the process. It was a collective effort driven by consultation with members, with partners, and with staff. To conclude, 2025 was a year of both delivery and preparation, a year where we tried to have as much as possible dialogue and collaboration with members, partners, stakeholders, we need to maintain this momentum and translate it into measurable impact. So as I said, we need maybe more indicators, but we will do it with the 8th strategic plan. So this will be our collective responsibility as we move into the next strategic cycle. So I thank you very much for your attention, and I am here to answer your question if you have any.
Thank you very much, Dr. Emmanuel, for this comprehensive presentation, and I open the floors if you have any comments, considerations or questions. Yes, I see Bolivia. Micro, please.
Sorry, I need
here.
Muy buenos días. Hernando.
Bonjour. Well, good. Hello. I am the delegate for Bolivia. In the name of the Americas, I would like to thank the Director General for her report. And we do recognize that with these deliveries, the information and the development of standards and veterinarian services and their capacities and the global scale, and we've achieved a transition towards the 8th strategic plan for WOAH, and it's been achieved through a very participatory approach. And I would like to commend the work of PVFs in Bolivia. The goal is to provide an assessment, and we include the assessment of the dog rabies control. We perform all this in a very practical manner, and it's very obviously health-oriented. Thank you very much to Bolivia.
Over there, micro, please. First row.
Thank you, Madam President, and thank you to the Director General for that presentation. I wanted to note, as I did in Council, the huge amount of work and outcomes that the organisation has delivered in the last year, and the efficiency I personally think that you have with what is relatively a small budget for everything that you achieve, and commend WOAH for that and the management. Thank you.
Thank you so much, United Kingdom. Any other comments? Benin?
Merci, Madame la Présidente.
Thank you, Mrs. President. And now I would like to thank the Director General and their whole team for the high quality of their work on the quantity-wise and quality-wise as well. And we noted it in the African regions. Quite a lot of work and activities have been undertaken, and I'm speaking to commend all the support we've had from WOAH. This includes the PVS mission, but also, above all, the P3V project that provided great support. There are two other points that are crucial to me. The first one is about the development of online modules. This really allows us to have tools and educational resources in order to reinforce the capacities of the professionals who work with veterinary. So it is very good, and we have to continue this. And then it's also about the visibility of the organization. It is absolutely important to us. Our advocacy towards our authorities is above all through your support. When we speak about the One Health approach, veterinary services should be use what has been done at the global scale as a basis in order to sort of reassert their role in front of their peers. And the visibility work is crucial. I would like to congratulate you for this great achievement.
Merci, Benny.
Thank you, Benny. Any other comment?
I cannot see any. Do you want to answer or say something, Emmanuel? It was so very good comments that we get for the Assembly. Back to you.
Yes, Allô? Oui. Merci beaucoup à tous.
Thank you very much.
For all your very kind words. It's very nice to hear that. We will continue. We still have work, a lot of work, when you see what is that we need to do. Maybe just want to elaborate on the e-module. I think indeed it is very important. As you see, we have 56 now, but as you know, there is a lot to do, a lot more to do. And I want to highlight the fact that we are now working also on the recognition of modules that exist in members in different languages that could be labeled or recognized by WOAH. So we are now working on this process. We continue to produce, of course, modules, WOAH modules. But we also want to be able to take advantage of collaborating center work or members' work, and this is an important thing that we want to do. Of course, I highlight also the P3V. As I said, I was not able to name all projects, but P3V is a very important project for all. I have to say that the only thing I didn't achieve personally is that I am still not fluent in Spanish. But I continue to try and to work on it. Thank you.
Thank you, Emmanuel. Now let's proceed. Now it's time to adopt the resolution number 1 concerning the approval of the Director General report on WOAH activities. I can see that we have quorum in the room. So first question, are there any objections? I see none. Are there any abstentions? So resolution number 1 is adopted by consensus. And I guess, Emmanuel, it's time for you to present. No, we can go to resolution number 2? Okay. So let's proceed with resolution number 2 concerning the approval of the Director General report on WOAH management activities and administrative work. So first question, are there any objections? None, I cannot see. Any abstentions? Okay, thank you. Resolution number 2 is also adopted by consensus. Thank you very much, our Director General, for your presentations and continued commitment to the work of our organization, and especially to always empower our members. So we will move to the presentations and adoptions of the 8th strategic plan. And I'm happy also to give you the floor, Dr. Emmanuel, to present this very important tool to our organization. You have the floor.
So thank you very much, Madam President. So let's indeed move to the 8th strategic plan. Important moment for our organization. This strategy, as I said before, is the result of collaboration between members, also partners. And it is the result of a collective effort to define and share pathway forward. And it anchors our commitment to leverage animal health for a better future. And it is really grounded in partnership with other international organizations and grounded in foundation that has shaped this organization over a century. And at the same time, recognizing that to remain influent, we must also remain agile. So, as Director General, this strategy reflects also the commitment I set out at the start of my mandate, placing members, transparency, standards, and the empowerment of our animal health systems at the center of our mission. And of course, building on the work of my predecessor to ensure that WOAH is fit for times and recognize that disability is necessary to achieve impact. So I thank you for your engagement, for all the comments we received, your ideas, your challenges, and to make this strategy, it is not only for you, but with you. So, before submitting our 8th strategic plan for adoption, I want to present key elements of context. I will be short, because the main component of the strategy and our approach to translate it into action. So, and I will demonstrate how this approach reflects our commitments, not only define priorities, but also ensure effective implementation. To start, why do we need this strategic plan and why now? So we've been discussing this for 2 days around the world. We are facing a convergence of risk, emerging and re-emerging infectious diseases, antimicrobial resistance, disruptions to food systems, climate-related pressure on ecosystems, and growing tension in international trade and geopolitical instability. So we know that when animal health systems are strong, members are better able to prevent crises before they spread, and then we are weak the consequences can rapidly become global, affecting market, livelihood, and human health. Within this context, persistent disparities among members directly affect collective resilience. And by strengthening animal health systems and leveraging multi-sectorial collaboration, which are at the core of our strategy, WOAH, its member, and the broader community not only improve animal health and welfare, but also reduce wider socio-economical, ecological, and security risks. So the strategy is an opportunity for WOAH to move from delivery to measurable impact and to better demonstrate the value of animal health system for society, economy, and the environment. From the start of the 8th strategic plan, we placed strong emphasis on co-construction. So development started over 1 year ago and was marked by an extensive and inclusive consultative process. Many rounds of consultation with members allowed us to define strategic priorities that I presented last year, but reflective of the intersection between the need we must respond to, our ambitions, can have always very big ambitions, and operational realities. So by sharing a draft version of the strategy with members a few months ago, stakeholders also, and staff in later stage of the process, we guaranteed a wide range of feedback. And we really received a lot of comments, I have to say, from members, from stakeholders, and from staff. And this helped us to refine and strengthen the strategy. So I am pleased to state that in March, the Council approved the strategy and with it our vision, and I take this opportunity to thank Council members for their endorsement. So the objective was clear. We must build a strategy around an ambitious vision for the members, as I said, but supported by a coherent and realistic pathway for implementation. And so this, you will see now the structure of the plan which framed this objective. We have first the vision. So the vision is what we stand for. The mission is our purpose and capture our guiding principles. I will come back, of course, later on each of these. The strategic orientations describe how we'll achieve our mission. And finally, the enablers are necessary foundation that make implementation possible. And this, after that, we have a nice house. So our vision is simple. It captures the essence of the organization. It's anchored in the circumstance of our time. A world, this is the vision, huh? A world with strong animal health systems recognized as critical to tackling global challenges and ensuring a better future for all. This is the vision. And this is what we stand for. Our mission is equally quite clear: improve animal health and welfare by developing global standards, strengthening animal health systems, positioning animal health as central to tackling global challenges. We will continue to do so by principle, and this is also very important that we have this principle in the 8th strategic plan. That principles don't change. They are the same since the beginning of the creation of the organization in 1924. It's our DNA: scientific excellence, good governance and transparency, innovation, solidarity and collaboration. So the three strategic orientations define where WOAH must focus its effort and resources in the coming years to deliver on its mission. Our first orientation is really our core mission, is to develop global standards adaptable and applicable to all members. As you know, standard setting and guidelines development are central to WOAH's mission. In response to members' expectation, the goal is to increase adoption and implementation of standards, and we will do so by first reinforcing member participation in the standard setting process and enhancing understanding of barriers to implementation. This is what we mean by adaptable and applicable to all. It doesn't mean that we will have regional standards. No, we have global standards. But it is important that these standards respond to your needs, so you need to be involved since the beginning, then that the standards are applicable. It's not good to come here to adopt standards, go back home and not be able to implement them. And that if we see that there needs some modification, we are able to continue to modify them. And we need to be able to identify barriers one by one and address them pragmatically. And in doing so, we ensure that no one is left behind. Second, of course, very important for us, continue to reinforce the scientific foundation of expertise, which means broader expertise adapted to the new challenges that can arise. And third, promoting implementation through capacity strengthening, technical mediation, and advocacy. The second orientation is empower members to build robust animal health systems and strengthen veterinary public health. This is the logical next step. It captures our commitment to equip the animal health community with the knowledge, competencies, and tools needed to improve system performance. System performance means being able to notify diseases, for example, quickly when I really want to, again, as I did in my introductory speech, insist on this very important of the transparency and the notification process. To foster solidarity both within and across the region. So in doing so, our objective will be to empower members to reinforce their animal health system and access funding, facilitate members' access to knowledge, to foster collaboration. I think when we speak about TAD, it's clearly we cannot do without at least neighboring collaboration with neighbors, sub-regions, region, and reinforce preparedness and emergency management capacity. And for that also we would like to have some initiatives. Finally, we recognize that success in achieving our mission depends on how decision makers perceive and prioritize animal health and welfare. Therefore, WOAH makes visibility, advocacy, engagement with decision makers and general public its first strategic priority. Position animal health as central to tackling global challenges. Prioritizing visibility and maybe more than visibility, influence is one of the evolution of this strategy and a pivotal point. Being present where decisions are made, engaging the right actors and delivering clear, impactful message, which is not always easy, I have to say, to be here where decisions are taken, because we are not UN organizations, or sometimes we are not around the table, so we need to push. That's what we do with the team. But there is still work to do in order to be really around all table of discussion. So we have two angles. The first is to elevate animal health and welfare as a global priority in tackling global challenges through targeted advocacy with decision makers and strategic communication. And the second is to support members in communicating on priority challenges to influence their stakeholders, improve animal health and welfare worldwide. And we need, of course, to engage with right actors, delivering clear, impactful message. So these are our three strategic orientation. This ambition requires strong organization foundation, and this is the role of the enablers. So first, very important is our governance and partnership for scientific robustness and sustainability. This is the enabler for long-term viability. And here in the 8th strategic plan, you find all what we are doing in the a clear link with the GRC work, which means that we will implement the results of the resolution that you will take in the context of the work on the revision of our governance. And you know that there are three parts: the institutional governance, the financial governance, and the technical governance. And again, François will present this work a little bit later today. Second is the leadership in animal health data. We discussed a lot yesterday about new technologies, data. We need to be very strong on our own data and the way we use them, but we also need to think about how to be influent in this discussion about strategic governance, about data for animal health at global, and also discuss with you at regional and national level. I have to say that I don't see so clearly for the moment, but I think we need to maybe put in place a small group reflecting on that in our organization, because there's a lot of things going on, and I don't want us to be derrière, how do you say in English? Behind, thank you. So that's why it is clearly as an objective. We already work a lot on that, but maybe there is more work to do. The third one is people. People, what can you do without people, with the staff in particularly, but also all the experts that really, without them, we couldn't do anything. And I often say when I visit country and that I meet also with ministers that without you, members, we can't do anything. Without our collaborating center and reference laboratories, experts, this is very important. So people at the center of WOAH. And finally, the fourth is the performance and accountability. Of course, it is very important. They are enablers of credibility. So credibility vis-à-vis for you, members, because you give us some statutory contribution and voluntary contribution. So we need to be clear on what we do with this money. Accountability with partners. Maybe there are some partners in the back of the room. So we need to be able to demonstrate the impact of our action and animal health and beyond. So together, these enablers will ensure that a strategic plan is an operational tool. So we spoke a lot about concepts until now, but concept matter, of course, but through this presentation, I would like to share also those that will shape how we together lead an animal health response worldwide, and concepts are not enough, and what also matters is how we translate them into concrete action and hold ourselves accountable for what we have set out to do. That's why we have designed a robust implementation, monitoring and costing framework. Following adoption of this strategy, if it is adopted, we will kick off the development of implementation roadmaps. This is the project. This will outline concrete work plans and priority initiatives. And in turn, this roadmap will shape projects and programs carried out by the organization. Each level, strategy, roadmap, programs will be monitored by indicators with clear targets. And for transparency, accountability, we will report findings back to you every year. A draft list of strategic indicators and priority initiatives has been included in the strategic working document as an annex, upon which we will build a final one. And please note that this is a draft and that it is not for adoption. We have also identified two types of roadmaps: the WOAH Global Roadmap, which will be used for WOAH annual planning cycle, the working plan of the year, and the regional roadmaps, which will be owned and coordinated by regional commissions with, of course, the assistance of regional representation and reflective of regional specificities, needs, and context, because we know very well that each region has a specific context. So this approach ensures that strategic priorities are reflected in our activities. Then let's go to funding. What about funding the strategy? An important point to note is that this strategy consolidates existing activities, and at the same time there is introducing priorities. Many will not require additional funding compared to current level, but some will. To cover the full extent of the strategy, It's difficult to estimate, to be honest, but we estimated that we will need to maintain current level of fundings with a similar spread between statutory and voluntary contribution as 2025, as well as an additional 25 million euro over the next 5 years. This coupled with international reprioritizations. It's a nightmare for non-English speaking people. This will not impact the category threshold of statutory contributions. Again, it is an estimate, and we will revise as we develop the roadmap. To fund strategy, we will have to make resource mobilization, and so we will therefore align resource mobilization results with strategic priority, ensuring coherence between funding and action. In practice, we will implement the following process through structured and transparent annual planning cycle. Assessment of funding needs based on strategic priorities will be succeeded by resource mobilization, allocation, internal planning, assignment of budget. Throughout the year, we will monitor implementation, and at the general session, report back on the implementation of the plan and its funding. Planning will therefore be linked to annual budgetary reports, ensuring that the strategy guides both action and resource allocation. This will also mean that we will need to increase resource mobilization, and I'm very happy to tell you that we are working hard with Emilie Tagliaro these days on reviewing our strategy for resource mobilization, and I say Emilie, but of course with all the COMEX colleagues. So it's now time for opening the floor to question. I would like to again say that our strategic plans, I hope, reflect our collective commitment to strengthen animal health system worldwide, to reinforce solidarity among members, and to ensure that animal health is fully recognized as a strategic pillar of global resilience and sustainable development. It demonstrates our shared understanding that the challenges we face today require stronger cooperation, stronger system, and stronger political engagement. So this is a way of defining priorities for the organization, but I will then now open the floor for questions. I thank you very much for your attention.
So, in fact, this strategic plan reflects extensive consultations and collective work across all the regions and represents, as you have already seen, an important roadmap for the future direction of the organization. So, floor is open, and I would like to hear your comments. First, Senegal.
Merci bien, Madame la Présidente. Donc, je voudrais...
Thank you, Madam Chairperson. I'd like to congratulate the General Director for the presentation, but I would also like to pay tribute to the participatory process that led to the strategic plan. There was a lot of consultation. And if we look at the strategic plan structure, I believe it is extremely relevant, because it takes in consideration the new world challenges, global challenges. And therefore, I'd like to encourage WOAH and its members and congratulate them for the optimal and effective application. And Senegal is in favor of the adoption. Thank you, Madam Chairperson.
So, Chile.
Muy buenos días, Emmanuel. Gracias por...
Hello, Emmanuel. Thank you for this presentation. On behalf of all the countries in the American continent, we would like to support the 8th strategic plan developed by WOAH. We believe it is a very good plan, because the process, in spite of the repetition of some words, there was a lot of participation, and participation is essential. And we also have noticed that the planning process was conducted with a lot of dialogue. So all the work has made it possible for all the delegates. We're able to take one step further. We don't only talk about diseases, we also talk about management, economic management. And really, this is, I believe, really well shown in the strategic plan. So on behalf of all the American countries, we believe that this plan is going to be a very good guideline for the coming years.
Chile.
Thank you very much.
Thank you, Madam President. I speak on behalf of the Animal Health Quadrilateral Alliance, comprising Australia, Canada, New Zealand, the United Kingdom and the United States. We commend WOAH on the development of the 8th Strategic Plan. We acknowledge the inclusive and consultative process undertaken and the input provided by WOAH members. The Quads Alliance supports the adoption of the 8th Strategic Plan and welcomes its articulation of WOAH's priorities for the coming period. In doing so, we underline the importance of maintaining a strong focus on the development of science-based international standards and the promotion of transparency through timely and reliable disease reporting. These functions remain fundamental to safeguarding global animal health, facilitating safe trade and protecting public health. The Quads Alliance looks forward to continuing to work closely with WOAH, the Director General and all members to support effective implementation of the strategic plan.
Thank you, Australia. I now give the floor to Sudan.
Thank you very much, Dr. Manuela. It's a very good presentation. And I always, when people present strategic plan, I always feel uncomfortable because most of these strategic plans end up in filing cabinets or in drawers. But I like what you said from the beginning, that let us turn this into action, which shows that the strategic plan which you have presented, it has got vision, mission, values, and defined goals, which is really shows that this strategic plan is going to be implemented and executed. So thank you very much, and that's a comment I wanted just to make. Thank you very much.
Thank you very much, Sudan. I'll now give the floor to Azerbaijan.
Madam Chair, thank you very much for very comprehensive presentation of our next strategic plan. And that strategic plan, after long dialogue and discussions, came to today's position, which is you presented. And our strategic plan is covering all today's actual problems related with One Health, climate change, international trade, spreading of the different kind of diseases. And I suggest that all member countries bring together all our efforts for the implementation of that strategic plan. Thank you very much, and congratulations for the preparation of the good strategic plan. Thank you.
Thank you, Azerbaijan. I now give the floor to Sweden.
Thank you. And thank you so much to our Director General and to all the staff and to the Council for all the good work done also last year and until now. And we are very happy also for this well-structured, transparent, effective and relevant strategic plan that you are presenting. And I agree with the earlier speakers that I'm confident that you will make put it into action, and that's very good. So I need to just mention that Sweden still continues to have a budget restrictive position. We cannot at the moment support any raise in fees. So I'm very happy for your presentation, and I see that you work hard with the funding and you have good ideas to make it work for all of us. So thank you so much for all the work and also for all transparency. Thank you.
Thank you, Sweden. Any other comments? Guatemala, yes. I give the floor, please.
Muchísimas gracias, señora directora, por este.
Thank you very much, Madam Director General, for this strategic plan. We have always seen that WOAH, with a very limited budget, can do a lot in favor of animal health. And the donating countries are all supporting WOAH, and increasingly so, because the situation is being improved thanks to the WOAH strategy. Thank you, Guatemala.
Can't see any. We have someone, but you need to turn the other way.
Oops. Kenya.
Kenya. Floor is yours.
Thank you, Madam President. And I'd want to congratulate the Director General for the work she has done on engaging the member states in developing this strategic plan. And it really marks a deliberate transition from a traditional animal disease control model to a future-oriented global animal health governance framework. It is a really significant shift, and we do appreciate the direction that we are now taking with regard to the future of the organization. And also commend that it's very highly progressive, and it has aspects that is moved, that brings out the aspects of the costed implementation measures, and which has indicators which provide a clear roadmap to clear milestones that we need to achieve in the coming cycle. So I want to congratulate everyone for the good work done. Thank you.
Thank you, Kenya. And we have India also. Floor is yours.
Thank you. I would like to congratulate the DG WOAH for a very insightful presentation. And from the Indian side, with the largest livestock inventory in the world, so we would like to reiterate our commitment towards ensuring the animal health. And we hope the WOAH will extend all the support those countries which shares borders, international borders with the neighbors, and the countries with the large smallholder production system. So from the Indian side, we support the strategic plan proposed by the WOAH. Thank you.
Thank you, India. No other comments? Okay, so Emmanuel, do you want to say something to our delegates?
I want to thank you for your very encouraging words, and but now the most difficult is now to implement the plan. So we will do our best.
For sure. I inform you, I can confirm that we have quorum, so now we will proceed with the adoption of the resolution concerning the 8th strategic plan for the period 2027 to 2031. So, are there any objections? I see none. Are there any abstentions? None. So resolution number 3 is adopted by consensus by the Assembly. Thank you very much, Emmanuel, and thank you very much, me as President of the Assembly. I'm very happy with your positive contributes to this proposal of our Director General. It was an important presentation, and it was a very good work that was carried out preparing this 8th strategic plan. So now we will break.
Excuse me,
you want to say something?
Yes,
okay, Emmanuel,
I
please.
just wanted to say that now we need to work, so I have some... what are the next practical steps? Again, thank you. It was a lot of work, and I am very moved by this unanimous. But now we will publish the strategy in the coming weeks. Over the summer, we will finalize the strategic indicators, priority initiatives, and in parallel, we will begin to developing regional roadmap with you, with regional commissions. And you will receive more information in coming weeks. So thank you again for your continued past, present, and future collaboration and engagement. Thank you very much.
Yes, let's put it into action, as someone already mentioned. So now we will break for a short pause, and we will start at 11:30. Thank you. It's not working. Now, yes. Welcome back.
I'm going to go over there.
We have now a very important point in our agenda, and we will proceed with our session on the animal health situation worldwide. This session remains one of the most important moments of our general session, allowing members to maintain a shared understanding of the evolving global animal health landscape. So I have a pleasure, and I invite Dr. Jenny Hutchison, head of the World Animal Health Information Department, to introduce the session. Jenny, please, you have the floor.
Good morning, everyone. It gives me great pleasure to be here in this lovely venue to deliver this presentation on behalf of the WOAH team, many colleagues from other departments and the regions, and of course, I consider this is from you as well, as it is your data that I am presenting. So I thank all of you, and let's get started. Okay, so today I'm going to give you an overview of the global animal health situation and then talk about how this information is gathered and flows through WOAH, talk about how systems work together to add value and improve efficiency and reduce duplication, and then talk about how we support clarity and give a bit of a call to action. So I'd just like to start by saying that you can think of WOAH as a shared container of valuable information. It is, of course, only as good as what goes into it and how it's interpreted. And as a reminder, we do have, WOAH is the central repository of official animal health data, and that really sets us apart. So it is your official information that we present, capture in WOAH and present and make available to everyone. So let's begin with the global animal health situation. And as I said, I can only present to you what we have in WOAH, so we'll start first by just having a look at what the information is and where it comes from, and remembering that I'm giving you an update, an overview of the situation now. And in the Animal Health Situation Report, the technical document that was made available to you all, we covered the situation in 2025, but remember that, well, I'll tell you that we began working on that, drafting the text, early in 2026, even in December. And if you think about that, where do we get our information from? The Animal Disease Events module in WOAH, where you provide information about exceptional events, and also for those diseases that are reported only through 6 monthly reports from 6 monthly reports. But in January of 2026, when we wrote this, what information did we have available to us on those stable diseases? Only from those semester 1 reports that had been made available to us. So you might not, so if you are looking at the data there, you may find that perhaps the full picture was not presented there, and that's because the reports were not in, okay? So just bear that in mind. But first of all, let's look at what we've been getting through the Animal Disease Events module. Often we refer to it and have always referred to it as the early warning module, but we did realise that nowhere do those words appear on WOAH, so I'm trying to learn to say Animal Disease Events module, and that is where you report your immediate notifications and follow-up reports. And remember, as an obligation, you are required to report these, to notify us within 24 hours of confirmation, and then provide weekly follow-up reports. Well, look at how you've been doing. Well, is it what you've been doing? Yes, it is. But look at the record number of reports made in 2026. Yes, that does show great engagement by members in reporting, doesn't it? But it also reflects the disease situation in the world, you know, and I look at these numbers and I'd have to say that from October of 2025, October, November, December, January, February, March, we have been seeing absolutely unprecedented numbers of reports coming in, and they are largely due to HPAI and then ASF. So just an indication of the continued importance of these diseases. So on our chart here, the orange shows the immediate notifications, and our DG earlier today did report on the record number of these. I'm not sure this is a good thing at all. In 2025, we have also the dark blue, our follow-up reports, and then I'd like to commend members for their use of the no evolution reports in WAHIS, because those are the light blue ones. They are the ones where you meet your reporting obligations for the follow-up reports by telling us, I'm here, I'm aware of what's going on, but I have nothing new to report. Either the situation's unchanged or I have no new information, and you send a no evolution report, and we know that you haven't forgotten, and others can see that you are reporting well. So those are important. Okay, so the next slide here, and I'm never quite sure whether to be really excited about the improved reporting that you have all exhibited over the last few years, because I don't know, some of you will remember that over the last 3 years, I've stood here and I've provided a pink chart that showed the submission of 6 monthly reports. And in my first year in 2023, it was a bit of a dire picture. You know, we were not doing so very well, but you, I will say. And more recently, you have made a really big effort to get these reports in and get them in on time. And so that on the left, we have the terrestrial 6 monthly reports for 2025. And remember, there should be 2 of them by now, shouldn't there? Because we're here now in May of 2026. And we set you a bit of a target to get them in by the middle of March of 2026 so that we can have some effort to really get most of them, or at least a great many of them, processed, and recognising that we had this enormous bulge of submissions at that time, and with the best will in the world, our team are not superhuman. They do their very best. And you can help with that by ensuring that your reports are prepared according to the guidelines, and that any issues you respond quickly to, and we do our very best to get them turned around. So on these maps, what you'd like to see is that your country or territory is in dark green. That means you've submitted both your first and second semester 2025 reports, and well done to all of you who have done that. I would like to draw your attention to the aquatic side, because significant gaps do remain there. And as we'll see later in this presentation, not so very many of the aquatic diseases ever appear through the animal disease events module, which means they're mostly, when present, reported as stable through the 6 monthly reports. But if we don't have any 6 monthly reports, we've really got very little idea about what's going on. So I do encourage you to make use of the support that we can provide if you need assistance in getting started with that reporting. Anyway, let's move on to the next one. Is the annual report module. You might say, well, why does that matter? Because it's not disease. Well, it really does. So this module was reintroduced in 2024, allowing you to submit annual reports for 2023, and now 2024 and 2025. And what we find, and the annual report now, let me be clear, at this stage consists of the livestock population data. Why is that important? Well, it helps you put your animal disease information in context, you or people who wish to do risk assessments and risk analysis, to look at the context that gives the denominator data, because it makes a big difference if you have lots and lots of animals or only very few. So it is important. Also, our veterinary products and drug resistant department, they use it for the calculation of biomass, population biomass, and that's used for all their animuse work. So it's really very important. What we do see is that where countries and territories get started with reporting, they do consistently continue, but it's the ones who haven't begun yet that I think perhaps you could reach out to us and we could give you some assistance there. Okay, so having mentioned about reporting, and again, thank you to those of you who are putting those reports in, or perhaps your focal points, let's thank them too, getting those reports in and on time. And it's not just having the reports, it's their completeness of information. All right. and quality of information. So the global animal health situation, of course we can't talk about everything, but we're going to hit those high points. And I do feel really bad because we've got five major diseases there, and I'm only going to have 1 or 2 slides on each of those, and yet people have, webinars and meetings about this that go over days, and so doing it in 1 slide does seem really a bit sad. But I do remind you all that all the information that I'm going to present to you is in WOAH, and you can go and look there for yourself. And if you need help in understanding or navigating WOAH, do please come and talk to us. So our first disease that we're going to look at is foot and mouth disease. And on my slide here, I am reporting only the outbreaks that have been reported, and if I'm showing you location data with outbreaks, it must have come through the animal disease events module, because that's where that level of detail is provided. But what do we also know about foot and mouth disease? This slide is not showing where foot and mouth disease is. Of course, where the dots are, it has been, right? But there are many countries and territories who do report foot and mouth disease as stable through the 6-monthly reports. And I'm not showing that information here. I'm just showing you here the distribution of the serotypes that we've seen. And here, we had most outbreaks reported for SAT2. But interestingly, these were only from a total of 4 Southern African countries. And in contrast, the serotypes A and O, so O is red and A is green, they were reported from 16 and 10 members respectively, so far fewer outbreaks, but far many more countries or territories. And the red ones, I just should say for O, so I'm showing outbreaks, but an outbreak here may be a single outbreak, or it may be a cluster of many outbreaks. It's just sort of giving you an idea of the location. But what I'd like to emphasize too is that we had 9 members who reported untyped outbreaks. And that is a concern, isn't it? Because it's really important for everyone that that there is the diagnostic capacity and the capability, so human resources as well as the appropriate diagnostic test kits and what have you, to provide that typing information for everybody's benefit, and so that you can determine, what is the most appropriate vaccine to have on hand, and it's really important to know that. So that is a concern to us, that it's not possible for, on occasions, at least 9 members to be able to type those outbreaks. And of course, not everyone needs to be typed, but we do need to know what's going on there if we can. I'm going to talk more about SAT1 on the next slide, but I would like to commend here the wonderful work done by our WOAH reference laboratories, who take this information and more, all the detailed characterisation they have, to provide a lot of supportive material for you all. So thank you, all of those. Okay. Ooh. We went too far. We go back one. There we go. So this slide, I'd like to talk about SAT1, because this one, over the last few months in particular, is really causing a great deal of concern, because we've seen expansion of this serotype outside of Southern Africa, where we know that it's where it hangs out. And now we've seen, over the last year and a bit more, first occurrences in Azerbaijan, China, Cyprus, Egypt, Israel, Kuwait and Palestine. And again, as always, I am telling you what is reported in WOAH. And so this is an unusual spread beyond the traditional geographic range, and it represents and poses a high risk to these naive populations who have no immunity, and therefore, not unexpectedly, we do see quite severe clinical disease in these animals. And so, I mean, I know we're all aware of this, but it is really important that the appropriate vaccine that's effective against these strains is available and is used, and that surveillance, including just clinical surveillance, is performed in order to ensure early detection and reporting of the cases, and that the reporting to us is timely and detailed. And I'd like to make just a little reminder for those of you who are faced with this situation, foot-and-mouth disease outbreak, and initially it may be untyped, please report once you have confirmed, once you know it's foot-and-mouth disease, please report. You can submit follow-up reports with that more complete information as it becomes available to you. That's what follow-up reports are for. And we do encourage that detailed characterisation, as that is really, really important to all those who are working in this area. Okay. Moving on to our peste des petits ruminants, and excuse my pronunciation there, but I'll just call it PPR, that will be more acceptable, I think. Here, we're highlighting this one because, again, we're seeing an expanding spread and an increased global risk. And here on my slide, I'm not showing you outbreaks, but I'm just pointing out the dark red is where we've had first occurrence in a country or territory, and the pinkish red is first occurrence in a new zone, but I haven't mapped which zone it was. It doesn't mean the whole country or territory was affected. But, and in other areas, it is a recurrence after many years. So the first detection in Europe in 2025, we had Albania, Croatia and Hungary, and in Asia reported in Vietnam. And this is truly a big issue, isn't it? Because it's in small ruminants, and we know that there's often a great deal of transboundary movement of these little beasts, and it does provide, when the disease goes with them, an increased threat to animal health and to human livelihoods. So we do again need early detection and reporting, targeted biosecurity, targeted vaccination and strong biosecurity, and coordinated regional and global action. And I do think this one's well, they're all important, aren't they? But we know PPR has the global campaign, eradication by 2030. And I don't know about you, but 2030 is coming awfully soon. And so there's an awful lot of work to do. I would also like to remind you that this chapter is under revision by the Code Commission. And so it's out for comments. I do encourage you to read, review and comment on this, because it's proposed for adoption, I think, in May 2027. Yeah. So there's an opportunity to make that as fit for purpose as is possible. Okay, my next one. Again, here we have sheep pox and goat pox, where we're seeing a disease that's been endemic in Africa, the Middle East and Asia for long periods of time. So I'm not showing them on the map. What I am showing you, in case you're not so familiar with this area of geography, is a portion of Europe. The body, I had to look this up properly, the body of water to the top right is the Black Sea, the one in the middle is the Aegean Sea, and on the left we have the Ionian Sea. So there you go. And what we're seeing here is this continued expansion in this area of Europe, with over 85% of the outbreaks that were reported this year were in Europe. We saw the first occurrence in North Macedonia and Serbia, with new zones affected in Romania, and a recurrence in Greece and Bulgaria. And so this is, it's a really important disease. It's had a huge impact. We've had more than 160,000 animals culled. That's a lot. And and we would say that the high concentration of outbreaks that we're seeing there does indicate a regional amplification. So again, the same messages. What do we need? Early detection, timely reporting, please, strengthening of surveillance, awareness that this is a problem and it's not so very far away from many of you. And control is needed with the movement restriction for these. Again, these are obviously small ruminants, sheep and goats. Biosecurity, vaccination, coordinated regional action, same message. And again, this chapter is under revision and out for comments, and again is going to be proposed for adoption in May of 27. So please take a look at that one as well. All right, moving on to HPAI, avian influenza, and I'm going to say in birds, because the next slide will talk about not birds. This slide is showing us both poultry and non-poultry. I find this really interesting because it shows the different epidemiology, even just looking at these numbers in these two types of animals or production. So in poultry, we had 50 countries or territories reporting outbreaks, and for the non-poultry, 53 countries or territories. And on my slide, the orange bits, the orange dots are the poultry and the green ones are the non-poultry, which would be wild birds or backyard birds, yeah, backyard domestic ones. So we see a lot of dots on the map, and there's many points. I could talk about this slide all day, but I won't, I promise. So you look at that and you think, oh, poultry, only, 1,700 outbreaks, and yet in the non-poultry, we see more than 6,000 outbreaks. Does that mean it's more important? I don't know. How do you measure importance? But it's clear that the poultry outbreaks look at the number of cases that have been reported. And again, we've got dots on the map. This is coming from the animal disease events module. Does not include any of the information that may have been reported for the cases, for the situations where it's been reported as stable. So 15 million cases in poultry. This disease continues to ravage the industry, doesn't it? And 111 million losses reported for poultry. It's big, it continues to be big. Perhaps in a way we feel fatigued by hearing about it all the time, but it still is such a hot topic. And I remind you that in 2024 we had the technical forum on HPAI, and last year we investigated vaccination very intensely, and I know that the side event, looking at the experience of France with vaccination was very well attended, so it's clearly of great importance. I would like to just, because I was looking at this map myself and I was thinking, okay, we see dense areas of reporting. But is that the only place where disease is? And if you're not seeing dots on the map, what does that mean, do you think? Does it mean there is no disease? Well, that would be lovely for the birds, for the industry, for everybody, if there were no disease. But is that the case? I don't know. Is it because there was a lack of reporting? It might be. Is it because there was an inability to detect disease? It could be. Is it because no one was looking for disease? It might be that too. I don't know. But you can figure things out a little bit or look more closely, because if your question is about how are people reporting, first of all, of course, you might look at the animal disease events module. You might find, if you don't have disease, you would expect not to see anything there, except you might find stable event markers which tell you, okay, they're only going to report through 6-monthly reports, okay, so maybe there's that. But if your question is how well are these people reporting, you can look to see through the disease situation dashboard if there's any information reported for that semester or year. You can look there. And if they have reported, and they've clearly reported the disease to be absent, you might ask yourself, how do they know that it's absent? So you could look to see if they report any surveillance or control measures at all. And I remember back in the early 3 or 4 or 5 years ago, when I wasn't standing here, but I was still very interested in this. I was not as aware of the wonderful richness in the WOAH dashboards, but we do have a WOAH dashboard about surveillance and control measures. So you can go and look in there and see what do people say that they're doing for these diseases, and in both domestic and in wild. So I do encourage you to investigate that, because it can give you a lot more information than I can show in these dots on the map. Okay, let's move on to, so this was HPAI in birds, and I made that distinction because the next slide is about HPAI in mammals, and I say in an evolving interface, and it certainly was a bit confusing last year in 2025. You may remember, I think, at the general session we mentioned that HPAI in bovines, dairy cattle, had been declared by WOAH as an emerging disease. So that was sort of the middle of the year. Before that, we had a mixed reporting model where some people were reporting HPAI in mammals as an unusual host against Article 1.1.3. Okay, so it was that stuff appearing in WOAH. We also had others saying, no, that's for birds. I'm going to report against Article 1.1.5, voluntary reports. And so we did have a little dashboard bringing those things together. And of course, then halfway through the year, we had the detections in bovines becoming an emerging disease, and therefore they must be reported through WAHIS. So that's a bit of a combination report. Now, after that, we are it's a bit more clear. So if it's got feathers, it goes through the regular notification procedures as either HPAI poultry or HPAI in non-poultry or wild birds, okay? So good, WAHIS. If it's in a bovine, in a cow, dairy cattle, you know, that goes as an emerging disease, and everything else can be voluntarily reported against Article 1.1.5. And indeed, in 2026, we've had outbreaks reported in 15 different wild species, but mammalian species, from 5 countries or territories. And you can find all about that in a dashboard, which I will show you later. Okay, so thank you for those of you who have persisted with this reporting. It is really important that this reporting does continue because it informs our specialist commissions who are tasked with evaluating this type of information. All right, moving on from avian influenza in whatever beast, we're going on to African swine fever. And that has been really important because of its persistence. I mean, the stuff is here. We've had a lot of reports. I did mention that particularly over the last few months, our reporting burden in the animal disease events module has been due to HPAI and ASF. And we've seen in 2025, we had 30 countries and territories creating new events, so we had 78 immediate notifications. We saw the first occurrence of the disease in Bosnia and Herzegovina and in Chinese Taipei. And note here, all the outbreaks in wildlife were in wild boar, Suscrofa, okay? Just remember about that, because it'll come up later. And this year, from January to the 4th of May, we've had 5 countries and territories reporting 7 immediate notifications. So the countries or territories affected were Bhutan, Côte d'Ivoire, Latvia, Lithuania in January, Ukraine in March, and Bhutan in April. But it is an interesting disease, and if you were to admire a virus at all, you might admire this one for its ability to persist, to spread in different ways, and its ability to be transmitted through animal products is almost secondary to none, isn't it? And perhaps that does explain these large gaps and jumps that we see, because when we look at the maps and we see big distances between known outbreaks, we ask ourselves, well, how did it move? And so, for many of the diseases, we say, okay, in between there, was it unreported? Is the disease actually in the country or territory and just wasn't found or reported? Or maybe in this case, it's because of the movement of animal products. Perhaps that's the case. And it is just interesting to consider this because it does affect how you approach your prevention and control. Okay, my next slide is about diseases in wildlife. And here I'm going to say listed WOAH diseases affecting wildlife. Now, you will know, of course, that in the disease-specific chapters, you will find at the beginning the case definition, where basically it'll say, for the purpose of the terrestrial code or words to that effect, and it will tell you which animal hosts the disease is notifiable in, and it will tell you, and it may indicate that other species are susceptible, it'll tell you about notification. Well, there are indeed quite a number of diseases where wild species are specifically mentioned in the case definition, and therefore we do like to see the notifications when it occurs. So I was intrigued when I prepared this map because I'll talk about the figures on the right, just out of interest. So we had 67 countries and territories reporting outbreaks in wildlife species in 228 events for 16 different listed terrestrial diseases. And if any of you wish to count the numbers of diseases I have on the map, you'll note that there's not 16, and I'll tell you why. And I've got here 21,430 outbreaks, 95% of which were in Europe. And I thought, well, that is an awful lot of outbreaks. But I've already given you the clue about this. Where do you think many of these, well, not even just most, where do you think those outbreaks have been reported? Which diseases, if I had to ask you? But I guess we can't really get answers, but we've already talked about them. HPAI, remember wild birds? Those are wild species. And I gave you a big hint with the African swine fever, the wild boar, Scrofa. And so I asked myself, okay, so out of all those outbreaks, what percentage of those are due to those two diseases? The answer may surprise you. 13,000 outbreaks for African swine fever. This sounds like, wow, that is a lot. But remember, for those of you who have the disease, you know very well, most of the outbreaks in the wild boars, it's one wild boar found. So many of those would be single animal outbreaks. Okay, so 13,000 for African swine fever and just over 8,000 for HPAI in the wild birds. And again, it's one dead bird usually, another dead bird here, so lots of outbreaks. You add them together, it makes about 20,000 outbreaks. So in fact, of my 21,000 outbreaks there, in fact, 98% of those were due to African swine fever and HPAI, which leaves me about 1,000 outbreaks reported in 94 events for the wild animals, affected by these listed diseases. And I do like the comment we have here, because it really is an important thing, because 15% of these species affected have been listed as either near threatened, vulnerable, or endangered. So we are concerned about the effect of these diseases on biodiversity. But I'll take a moment here to give a bit of a shout out to the non-listed diseases of wildlife, which we're interested in, of course, but those you cannot report through WAHIS because we deal with listed diseases, right? But there is another mechanism for you to report outbreaks as they occur. And I think many of you will have seen the Wild Epi demonstration at the kiosk after the break, during one of the breaks. Please go and have a look at that as new voluntary reporting mechanism so that you can actually tell us about the non-listed diseases of wildlife as they occur. And we'll be, next year it'll be interesting to see how that system has been going. All right, my next most interesting slide is about diseases in aquatic animals. And I started out by saying, oh my goodness, aquatic 6-monthly reporting is not quite up to what the terrestrial reporting is. So we often don't have six-monthly reports for aquatic animals either at all, or they're quite late. But we also, if you look at this, we don't get much reported through the animal disease events module. So in the 15 months, I have had 98 outbreaks from 18 diseases in 35 events from 20 countries or territories. And I mean, that's not very much. And I don't think, looking at the map, that you could say that the aquatic animals are just blessed because there's no disease. I don't think it's that at all. I think there's a lot of disease that's, endemic or stable, or is considered to be just reported through 6-monthly reports, but we don't see it. But, I do encourage you to report disease. It helps people understand what is going on. But just for comparison, I've got 98 outbreaks over this 15 months. For terrestrial animals, there were 37,411 outbreaks in the same time period. There is a big difference here. I mean, admittedly, we have 122 listed diseases, of which I think 31 are for aquatic species. But even so, I would say that we're not getting a great deal of information through the animal disease events module. And maybe that's appropriate for the way the disease presents. But nevertheless, it is good to report promptly and on time, and completely. Okay, so that was the end of my animal health situation part. And as always, there's a great deal more to be discovered in WAHIS. And at any time, we are happy to give you a demonstration about how to find that information and use it appropriately. But I'd like to turn now to how we work to get the information in WAHIS. Now, of course, it's outlined in the code, chapter 1.1. So, article 1.1.3 tells you about your obligations for the listed diseases. 1.4 tells you about emerging diseases, and 1.5 tells you about your voluntary options, all right? But, one of the reasons that I don't like calling our animal disease events module the early warning module is because in this day and age, there's often information circulating in the media before there is a WAHIS notification about a disease. And why is that? It's because as delegates, you have absolute responsibility to make sure that that information that you report is reliable. And you're going to wait, and you'll wait for confirmation, and then you'll report, I hope. But that does mean that often there will be reports circulating in the media ahead of that, and not just we can find that, but your trading partners and everyone else becomes aware of that, don't they? So we have our active search team on this, and so their task is to review signals, to use the mechanisms available to search, to trawl through the news, social newspapers, online media sources, social media, almost everything, as well as our networks through GLUES Plus and the WOAH reference laboratories, to become aware of signals. And when we do, we check. We look to see, has this already been reported in WAHIS? Do we see that a draft is in preparation? Do we know the reporting history of that member, you know? And if that's the case, that's fine. But if not, we will make contact with you, the delegate, and say, well, you know, we have seen this news. Can you please, you know, if it's confirmed, please report as according to your obligations, you know, either by an immediate notification or a follow-up report, or even in the 6 monthly reports, we look for it there, okay? Or if it's not the case, can you please give us some information about why that's not the case? Because of course there are times when the media does get it wrong, we know about that, with misinformation or disinformation, but it's good for us to know that too. So we talk to our members, and then we expect either the mandatory reporting that's required, or if it's not actually for a listed disease, then we sort of think, because we look for not just things that might be a listed disease, but we look for what we call emerging threats, for signals that may represent something brewing that might need to be considered as an emerging disease, that might need people to know about it. So we ask then for you to report, make a voluntary, well, we would remind you that the option to report voluntarily against Article 1.1.5 is there for you, and we have streamlined that process. And then we have a dashboard that now brings that information together, and you are able to be alerted about a new report by signing up for that on the distribution list. It's not the same list as for the immediate notification, so you have to separately ask to be reminded about this. And so it's important. It informs you of new things that may be popping up that maybe we don't really know too much about. But of course, avian influenza in mammals, that's where that goes. But why is it important? Because it does support our specialist commissions who will be looking at, you know, should this be considered as an emerging disease? Does it provide support for the listing of a disease? And can it provide information or updates about animal hosts for notification as things change? So, you know, as members increasingly share information from, you know, these diverse sources, it becomes important that we put this stuff together well. So I would just remind you that what we do is we do examine information from diverse sources and contexts, and we use it to help you, to support you to make timely, appropriate official reporting and the sharing of emerging issues, the voluntary sharing of things that may be emerging. And once that information is formally reported, and we have it in WAHIS, it becomes part of that official global picture. And at that stage, once it's in WAHIS, it's really important that the information is clear, consistent, and is described in a way that everyone can understand and will interpret in the same way and can rely on. And, you know, it's not enough just to have the information in there. We work really hard to get the information in there, as do you, but it needs to be reliable. And that is my next point, actually. So this is where WAHIS itself plays a critical role. And I mentioned that WAHIS is the container of this important official animal health information. And it's important that this system is robust and continues to provide the service that is needed. And here I'm going to make reference to the important theme of this meeting. I would say that WOAH provides the shared platform through which member investment in animal health reporting delivers long-term value. And you know, we've had many years of intense development of WOAH, and now we're at a stage where we're in a stabilisation and maintenance phase, and acknowledging the need for continued improvement to better serve your needs. We are well aware of that, and many of the areas that we work on do include reducing the duplication of reporting, and we'll talk more about that in a moment, and making sure that you're well supported in your reporting. So our focus is on ensuring that WOAH remains reliable and reduces the duplication of effort and is accessible and usable for members as your needs evolve. And all that takes continued investment, I would say. Okay. And so, at the same time, we do continue to strengthen how the information is expressed in practice. So I mentioned we work on the system, we work on the reporting, but we also work very hard on the quality of the information and how it's interpreted, because we want to avoid misinterpretation so that people will understand the disease situation no matter where they look at in WOAH. And that's why we have been implementing a harmonised approach to stable diseases, which does represent, although it's not new, it does represent a change in emphasis. And please come and talk to us at the kiosk about this if you have concerns or would like to indeed discuss further. I did talk about this to our Middle Eastern and the American Regional Commission meetings on Monday, but I'd be happy to talk further with more of you, yeah? So in avoiding misinterpretation, one of the other areas we've been working on, and this is particularly in your 6 monthly reports, is the appropriate use of occurrence codes. So that if you say, in particular, I'll go with disease absent. If you report to the world that the disease is absent, it should mean something. It should mean that not just that, oh, we haven't looked, so nothing's come to our attention, or we have received no submissions because it's not notifiable in my country. You can't say it's absent if you don't know. So we do ask, and this brings us on to the next point about ensuring sufficient context, that if you're going to say, for instance, that the disease is absent, I would ask how you know, and I do suggest that you support that occurrence code or any other occurrence code with appropriate surveillance and control measures that support that status. And we do encourage you to spend some time on that, because I know that historically it's been sort of a bit of an afterthought, but it really, really matters, because it gives those who consult your information confidence that this is a meaningful result. And we do working very hard on consistency, both in your reports over time, between countries, between my team members working on your reports, and we are targeting follow-up with you. I do ask that you encourage your focal points to respond promptly to our questions, because it enables us to get your reports published in a more timely manner. And there are times when we are just unable to contact you, and it's not easy for either you or us, I think. And we're continually trying to improve our processes. And of course, this does not happen in isolation. And the value of your reporting, we recognise how precious your time is. So where we can, we're working to make things more efficient. So now I'm going to talk about how WOAH works together with other systems to strengthen the global picture and ensure that the information reported by members can be used effectively beyond a single platform. So our first example is ADIS. Now this, I have to say, is an amazing success story. It's the interconnection between the EU Animal Disease Information System, ADIS, and WOAH. And here, this is information reported by you who are involved through ADIS, and then it flows through into WOAH. Previously, prior to last year, you had to do essentially the same information twice, and that was a huge chore. So at the moment, we now have 44 members and their territories, with the exception of Andorra, interconnected with to date, 499 events, 17,000, we just have to love these numbers, 920 outbreaks reported to WAHIS. And I can only commend the excellent support provided by the Addis and WAHIS support teams. Now, let's be really clear about this. This is a huge technological achievement. I would say it's as if the systems, Addis and WAHIS, were married. And what does that mean? It meant it was a very expensive proposition. They had a big wedding. It took a lot of preparation in advance and a long time. But a marriage it's not just the wedding, is it? It continues. And you need continued investment by both parties to have continued success. It's you know, is it forever? Are marriages forever? We'll see. But it does mean I would hope, but it does mean that we have to continue working together. The job is not done. So as our needs evolve, as Addis needs evolve, we have to come to agreement, we have to work together and carry and continue. So I would like to acknowledge and thank our EC colleagues for this amazing collaboration and massive investment that they have made to date, and everybody else supporting WAHIS, of course. Our colleagues are with us at the kiosk in this lovely break area. Please come and talk to them and talk to us if you'd like to understand more about just what all this involved. Okay, so this was information flowing into WAHIS. I'll talk now, just briefly, about another initiative in Asia and the Pacific, which is aimed at providing a better regional picture. And this is, I'd have to say, very much in pilot stage, and it involves the use of WAHIS's existing capacities and features to provide timely and detailed data. So what do I mean by that? So it's using the WAHIS Animal Disease Events module to report all disease outbreaks. For terrestrial, it's limited to 11 ASEAN member states, and it replaces what used to be called ARAHIS reporting, which ASEAN Region Animal Health Information System reporting, for 7 priority WOAH-listed diseases where there is, you know, regional action being taken. So it's really important to have that detailed information. And it's not enough to find that information in 6 monthly reports, because by the time that's made available, it's out of date. It's not very useful for guiding immediate actions or for strategies. And the information in the 6 monthly reports is not detailed enough. You don't get that location information. Now, the aquatic, and so that began from 2025, and it's you know, takes time and is a change. So that is underway. The aquatic situation is a little different, has only just begun, and is very much pilot, where here it's the whole region. In collaboration with NACA, members have traditionally reported both listed and non-listed diseases to NACA and the listed diseases to WAHIS, making multiple portals of reporting. But this has only just begun, and it is very much in a pilot stage. We'll see whether it is functional. I'd like to get back to you next year on this. So you could see why that this attempt was made, because timely and detailed data does support decision-making, and in theory, it replaces duplicated reporting. So information reported to WAHIS is then provided to the ARAHIS dashboards, or then to the NACA for summary. And so it should improve situational awareness, and it should reduce the burden of reporting. However, there are definitely challenges in managing change. It's difficult. It is a change in how things are being managed. And I would say, because a lot of these diseases, especially for the aquatic ones, are endemic, and it may be very difficult to have the data available even quarterly, and the resources needed for reporting certainly need to be considered. So it's just to highlight that we are looking and exploring different options on how we can use WAHIS to better support regional needs, but we will see. Anyway, bringing this all together and wrapping up, I'd like to just have a call to action, because I'd like to remind you, because I've sort of said it many times, what weakens the global picture? Well, for us, It's when your submissions are delayed. It reduces the credibility of WAHIS because we're supposed to be the repository of the official animal health information. People come to WOAH, to WAHIS to find that information. And if it's not there, it reduces our credibility and it doesn't support you either. So missing reports, I mean both geographically and for those critical diseases, when they're missing, it's a problem. And also when the information is incomplete or not accurate is also a problem. So it doesn't take much for the picture to become less clear. So I challenge you to work with us to continue to improve. I think continuous improvement is our message here. So our support and next steps, and you can immediately see that this picture is from these two pictures are from last year because that's the Maison de la Chimie, isn't it? So our kiosk there, come look at the WAHIS kiosk to see the lovely new environment that we're in. I think we're doing a much better job of being able to talk to you, and our ADIS team is there. And we're having behind the kiosk, we have a lovely setup for our business discussions, and I thank you to those who have participated in those. I have my team rotating through. They will speak English, French, Spanish, and many other languages if you just let them know what's needed. And they will have the discussions about your reporting and how they can best assist you. We also have a networking event this afternoon. So, you know, lovely to meet you, delegates, and I'm happy to talk with you at any and all times. But we'd like to invite the focal points, if they are here today, to join my colleagues and myself and Mosse, I think, at 4:30 today at the break at the WAHIS kiosk. We'd like to help them get to know each other better in person and to thank them in person. We also have prizes if you come and play the game at the kiosk. Okay, and lastly, that's the WAHID team, okay? So I would like to thank you all and to entertain any questions that you may have. Thank you.
Thank you very much, Jenny. It was, in fact, a very good presentation, very enthusiastic and very important that you shared here with us. So I would like to open the floor. You have any comments or any questions that you would like to share with us, considering the information? I see Gabon, France, Mexico, France. Okay, starting by Gabon.
Merci, Madame la Présidente.
Thank you, Madam Chairperson. First of all, our heartfelt thanks to Dr. Jenny for this brilliant presentation. I just have a few things I'd like to highlight. We clearly see all the efforts made by WOAH to keep us informed, keep the members informed, especially with WAHIS. But maybe we should more regularly be informed about this, because we have recently seen many efforts being made regarding antimicrobial resistance, for instance. In almost all the regions, there is one workshop every year dedicated to antimicrobial resistance. But with regard to WAHIS, we would like the focal points to be trained, informed, because it's not easy for them to use the WAHIS system in an easy way. It's not easy to use. And I don't know where WAHIS stands right now regarding the collaboration with the AABA. We have seen the collaboration with ADIS, but can you say something regarding the ARIS system?
Yes. Thank you. Sorry, my problem with that. Thank you very much for the question, and thank you very much for the appreciation of the presentation. It means a lot to me. I do understand your interest, and I appreciate your interest in being more regularly informed, and I well note the good work done by our AMR colleagues. I would like to just remind you that we did indeed conduct WOAH training in the African region for both English and French-speaking countries last September for focal points. The English-speaking training was in Johannesburg and the French training was in Côte d'Ivoire in September. I do understand that not everyone was able to attend this training, and that there is often a high turnover of focal points, but I also can remind you of the excellent online support that we do provide with the onboarding of new focal points, and our team goes above and beyond, I think, to have those video calls with your focal points as they are onboarded and going forward. I understand the limitations at times and difficulties with internet connection. I would like to deliver in-person training much more often. Workshops, training, I would. However, it is at great cost, and that money must come from somewhere. So if this is an investment in animal health, it needs to be, we need to receive that money to conduct that training. I do not have it in my budget. I am reliant on contributions to deliver it. In addition, it is a big commitment from my team to send people to training, which we do dearly love to do, but it also means when they're off training, they're not at the office working and processing reports, so it is a balance. Regarding the collaboration on ARIS, we are actively working in that area. My deputy head, Dr. Peter Mellons, who is also the WOAH Business Program Lead, has been conducting and attempting to conduct meetings with the relevant parties in Africa, but also with FAO on this, and I know those meetings continue, so please, I look forward to hearing more about that myself too. Thank you.
Thank you, Jenny, and I'll give the floor to France.
Thank you. I speak on behalf of the 27 member states of the European Union. I would like first to thank WOAH and Dr. Hutchinson in particular for the work done by her and her team to promote global transparency of the animal health situation. A continuous risk that we recognize for the EU is a consequence of the still ongoing, unprovoked Russian aggression against Ukraine. This senseless and brutal aggression by Russia jeopardizes the application of proper animal health measures in Ukraine and therefore irresponsibly increases the risk for animal disease outbreaks in the neighborhood and beyond. As regards foot and mouth disease, the EU would like to highlight that Germany, Slovakia, and Hungary have regained their respective WOAH official status following the successful eradication of this disease in 2025. These three member countries are again foot and mouth disease-free country where vaccination is not practiced. This was possible thanks to a rapid application of regionalization measures, strict biosecurity, extensive surveillance activities, and, in Slovakia and Hungary, also thanks to emergency suppressive vaccination as part of the eradication strategy. These events demonstrated the importance of preparedness and the immediate availability of effective vaccination tools for emergency response. In this context, the EU wishes to underline the critical role played by the different EU vaccine banks, which were activated in 2025 to support emergency vaccination activities in member states and contributed to the rapid control and eradication of both FMD and LSD. EU vaccine banks are also available for certain other priority animal diseases to be used as needed by member states and neighboring countries. As regards lumpy skin disease, the EU stresses the success of the eradication strategies laid down in the EU legislation put in place by the country where outbreaks have been declared. This strategy has helped to control the spread of the disease. Looking more broadly at diseases such as HPAI and ASF, the EU considers that the significant number of notifications originating from Europe, as reflected in the report, demonstrates the existence of effective surveillance, early detection, and reporting systems implemented in a systematic manner. At the same time, we regret to note that important regional differences still persist worldwide, highlighting the need for further efforts to strengthen surveillance capacities and ensure timely and transparent reporting at global level. We invite all member countries to prioritize surveillance and notification activities in a systematic manner. Thank you.
Thank you, France. Now I will give the floor to Mexico.
Gracias, señora presidenta.
Thank you, Mrs. Chair. Mexico is one of the 33 member states of the Americas, and we commend the excellent work performed by the organization and by the Department of Animal Health Analysts. In the written report, we mentioned NWS. It is a disease that affects South American countries, and now it's starting to disseminate in the center of Americas and Mexico. NWS had major consequences in Americas, including the bovine sector and goats. This led to productivity slowdown because they had to manage disease prevention and use veterinary products to curb the disease, and while taking animal welfare into account, as well as other aspects related to problems with insects, flies. So this is a major epidemiological change in the region, and this shows the great need to maintain permanent monitoring systems and biosecurity and movement control systems. Thank you for your asking what. Je donne la parole.
No, it's Guatemala. Guatemala over there.
Perdón, pero no tenía el micrófono.
Sorry, I didn't have the microphone. I agree with everything my colleagues said about the excellent presentation by the doctor about WOAH. I remember that in the past, when WOAH had just started, there was very little, and now over the years we've had a lot more transparency and information. So I invite all countries to send notifications, and I'd like to thank WOAH. We've seen the immense progress that's been made with such little money. So thank you very much, Guatemala, for these kind words that are very inspiring.
Thank you, Madam Chair. I will also be speaking on behalf of the 27 member states of the European Union. I would like to highlight the important milestone for the EU in strengthening animal disease surveillance in Europe and globally. As we've heard, the Animal Disease Information System, ADIS, is now linked to WOAH and fully operational. This connection allows 44 participating European countries and territories to notify outbreaks only once in the EU system and share them in real time with WOAH. This significantly avoids the previous need to notify the same information twice. We thank all participating countries for their collaboration and commitment in joining this new interface. User feedback has been very positive, with 90% indicating that the system is faster, easier to use, improves data quality and supports quicker decision-making. This achievement reflects the long-standing collaboration and coordination between the EU and WOAH, as well as between both support teams. The EU is proud of this success and stands ready to share its experience with other regions that may wish to follow a similar path. Finally, we would like to thank WOAH for enabling this connection between EDIS and WAHIS. While the process was demanding, we always found openness and a shared willingness to move forward together, and this deserves to be recognized. Thank you.
Thank you, Germany. Now I'll give the floor to Chile.
I would also like to thank you for your presentation, and I'd like to express the need to have correct information. Sometimes they are very sensitive information for trade, for instance, and in our country, this information has to be made public as soon as possible. I understand there is a validation process behind this, but sometimes when trade is at stake, I think it should be quicker. The process should be quicker, and I'm asking for additional efforts, especially for the HPI.
Thank you, respected Chair. So being a member country of WOAH, it's a responsibility of each country to have transparent reporting of the animal diseases. We from Nepal, we are reporting the disease as per the WOAH guidelines. My sincere request is, because of some trade-related issues, some countries, they are not reporting, there is under-reporting of the disease. How we can overcome the situation? So it's my request. Thank you.
Thank you, Nepal. You want to comment?
Yes, I would like to respond to that. You highlight a really important matter because, as always, I can only provide you what is in WAHIS, and yet you know there is more out there, yes? We follow up with the affected delegates, the delegates concerned, to request and require information. And I will say that there are times when I do not receive a response, and we do have a mechanism where we escalate this up, I would say, up the chain to do our very best. And yet there are times, and I know in some regions, there are very severe consequences for reporting disease that is worse than the consequences of not reporting, shall we say. And I think there are times, and we just have to, I'm sorry to say, I cannot make them report, particularly when they are facing very severe consequences for doing so. It's rare, but it does occur. But I think it is something that we can all work together, particularly in our regions, to all report better. I'm sorry, but I don't have the best answer. I cannot force people to report, but I can pursue those reports, and I do. Thank you.
Maybe if I can add, I think there are two things in the aspect of reporting. We do, as WOAH, try to support a lot in capacity building, in reinforcing veterinary services through legislation, giving and encouraging members to follow their respective responsibilities. But I think also, both at global and regional level, we have an awareness. At regional level, there is an awareness of what is working, what is moving, what are the specific diseases. And it's an invitation at regional level that whenever you meet, and you're talking about particular diseases, and you know that the disease is moving, to encourage each other to say, okay, it's for the benefit of everyone. We need to be able, for those diseases that you have identified within the region that are priority, okay, if there's a new outbreak, okay, how is the rest of the new zones or new territories being affected by a particular disease? How is the region going to react? Because we know that the diseases are moving. So it's also a matter of behavior. It's a matter of also recognizing it's not easy always to notify, but when countries or when members are doing the right thing, we also need to congratulate. And we also need to say, hey, I support you. I know you're going through a difficult time. How can we, within a region, work together so that the disease keeps being contained in that specific member, so it finally gets controlled, but also how the others are going to support. So I think it's two things. One is the responsibility of WOAH, where we're trying our best to build capacity, but also the behavior and the support of the regions to say we know what it means, to actually prize and congratulate those that are being transparent and really support that good behavior, and for those that are not having that behavior, to escalate it. To escalate and say, I'm sorry, but that is not possible. We really need to be transparent among each other. Thank you.
Thank you, Monse. It's really important what you mentioned now. Now, South Africa, happy to give you the floor.
Thank you very much, Madam President, and thanks, Jenny, for the brilliant presentation. Some of the questions that I had already been responded to, the very same issue. But also looking at the presentation from Dr. Jenny, you also had huge concerns about the fact that majority of the bovine population might be very naive to the SAT1. That is creating a huge challenge for us in the sub-region, the SADC sub-region. We've had quite a number of countries losing their status. But the huge concern is we realizing that the SAT1 is behaving differently from the normal SAT1s that we had in the past. And we also realize that there are some regions that have been affected, like the Middle East and so on. So I'm not sure if there's going to be any encouragement of the reference labs to also do some studies on the new strain, because we perceive this as not only a regional risk, but from our side, we also perceive it as a global risk because it will create problems going into the future. Thank you.
Thank you, thank you. South Africa, it was really good. Kenya, happy to give you the floor.
Thank you, Madam President. I also want to join in thanking Jenny and the WAHI's team for the good presentation on the animal health situation in the world. Kenya expresses sincere appreciation also to WOAH for its technical and logistical support during the HPAI simulation exercise conducted in Kenya between 5th and 7th May this year. The exercise significantly strengthened the national preparedness and response capacity for transboundary animal diseases, particularly HPAI, which continues to pose serious risks to public poultry production, food security, public health, and international trade. WOAH's support was instrumental in enhancing multi-agency coordination under the One Health framework and improving key emergency responses, including rapid reporting, laboratory diagnostics, field deployment, and risk communication. The simulation further reinforced the value of preparedness exercises in identifying operational gaps and strengthening veterinary emergency management systems. Kenya acknowledges WOAH's continued partnership in aligning national animal health systems with international standards and advancing biosecurity and One Health implementation. Kenya remains committed to applying lessons learned from the exercise to improve surveillance, outbreak response, and overall disease preparedness, while further deepening collaboration to safeguard animal health, public health, and sustainable livestock trade. Thank you.
Thank you, Kenya. Happy now to give the floor to Nigeria.
Thank you very much, Chair. Let me first of all reiterate our appreciation to WOAH, especially for the upcoming previous evaluation mission, which my minister mentioned earlier. It's been long awaited, and it's been a stumbling block to the bridging workshop that we're supposed to have to align with the joint external evaluation, which is very critical for us to come out with a document. Having said that, I also want to just put it on record again that this is the first time in the history of our country that we have the new Federal Minister of Livestock Development dedicated to livestock. I think, and no wonder you can see that my minister and then the permanent secretary, because of the renewed vigor, they are here with us. In fact, the minister is staying here till the end of the workshop to show commitment. On the issue of WOAHs, I want to really commend WOAHs for timely disinformation and communication, especially with my own country. Even when there are issues that are not clear, I think in less than 24 hours, once there's communication between WOAHs and my focal point in Nigeria, it was resolved. I think kudos to WOAHs and her team. Thank you very much. Now, here again, especially in Nigeria, we have the problems of less capacity and so many challenges, especially with wildlife and aquatic health. Honestly, I want to really seek, because I can, when Jane was going through the report, you could see a lot of progress being made in other terrestrial animal diseases globally. But in the case of Nigeria, aquatic and wildlife is a very big challenge. And I'm actually soliciting for more support in any ways possible to boost. Like I said, we have a new political head that is determining to change the narrative and the contribution of the entire livestock sector, global health and One Health, of which wildlife is important, and even the aquatic health. Let me also reassure WOAH that under the leadership of our minister and the permanent secretary, supported by the permanent secretary, even the reporting system that we have, that is the National Animal Disease Information and Surveillance System, is more robust. It's going to be so automated in such a way that we're going to have real-time interface between WOAHs and our country. Like I said, I don't want to make another different speech, but also appeal that being a new ministry, you can see we have a lot of challenges. Because a lot of things that we are hitherto not doing, our minister, with his commitment, is now committed to doing it. And I'm going to solicit on behalf, as the official delegate, for please, this robust engagement that you're already engaging, I can assure you that at least over the last 1 year, the engagement between WOAH, especially while he is on all the activities, has never been so encouraging than now. And I can see, like I said again, I reiterate the fact that as the official delegate, my minister has always given us all the necessary support, supported by the permanent secretary. And it would be very beneficial if we get this additional support in these areas and beyond. Even the issue of AMR that we're working on, I want to commit that as soon as we go back, some of the gaps that we identify between WOAH and the Central Planning Committee will be addressed. Thank you very much, President and the DG and all her team for the good work you're doing. Thank you very much.
Thank you. It was well noted. And now I give the floor to Paraguay. Here.
Well, thank you very much. Thank you very much, Mrs. Chair. I wanted to thank Jenny for her presentation. In Paraguay, we have one concern, and I wanted to... It's not under WOAH's responsibility, but, you know, Paraguay is a sub-region of the Americas, and at the moment, we are trying to have public discussions between the private and the public sphere on the foot and mouth disease. We've had information from the press that says that SAT1 is a global threat and danger, but we have no information on these specific issues. I understand that it's not WOAH's responsibility, and as Jennifer said, WOAH only has the information that it receives, but I would like to ask these countries that have SAT1 problems to inform us, because it's something that we don't know. It's exotic to us. There are many uncertainties. We are feeling very uncertain. There are sub-regions in Africa and other continents affected. So I'd like to ask the delegates to provide more information so that we can have more efficient. So I'd like to have this information from members who've already experienced the SAT1 problem, and then we will have the knowledge and we'll be able to address this issue. And we're going through a transitional step, and then we'll be able to take the right prevention measures that are required. Thank you very much.
Gracias, Paraguay. Now I'll give the floor to Benin.
Merci.
Thank you, Mrs. Chair. I would like to thank the WOAH for this excellent presentation. It gives us a very clear idea about the global health situation. I mean, it's very important for us. This allows us to better understand the health dynamics behind it. It is true that you cannot present all diseases in one single session, but in our countries, we continue to pay a heavy price for other diseases that affect animals, like conventional animals, like the rabbits, like viral hemorrhages. It's a disease that is still spreading in some of our countries. And I would like to tell you that some institutional systems do not allow to provide reports with regard to some aquatic diseases or wildlife diseases. So anything that could reinforce transparency should be worked on. We should work harder with the focal points in order to improve data reporting. You should reinforce them and really insist on the role that they play in disseminating information and making sure that health-related information is available. To finish, I'd like once again to thank you and reiterate what Gabon said earlier on. We should think about WOAH's interconnection. This tool was developed by Darabuha, interconnection with WOAH so that we could have the information on real time. Thank you very much.
Thank you very much. Now I give the floor to China.
I just want to share a question, and I want to speak in Chinese, so please grab your earphone.
First of all, I would like to thank Mrs. Chair. You've talked about the interconnection between ARIS and WOAH. So I would like to say that this is a cooperation between the government and WOAH. I would like to know that if in the future we could use the leading position of WOAH, to use WOAH's data so that it can be open to the corporate world and the public from the whole world, the mainstream, because we have a lot of data. When the data become open and they can develop data that may be applied or that are suitable to for their own platforms. This is like the weather forecast platform. From the weather forecast platform, we've developed other products, for instance, products about like what you can wear today, depending on the weather forecast.
Is open for everyone. It has no specific access constraint. Whatever is published on the website is public. But for long downloads that take a little bit more, that requires a lot more systemic information, a specific request can be done to WOAH to be able to do bulk downloads. Regardless, we're working to engage not only with the reference centers and collaborating centers to facilitate the use of the information to different animal health stakeholders so that this information can be used to do forecasting, to do to actually being able to use it for decision making. It's a slow process, but it's something that we are starting within the data integration department together with WOAH to be able to facilitate access to the information that it's contained not only in WOAH but in other databases within WOAH so that they can be used for better decision making. Thank you.
I can see that you have a question, China. Yes, it's working.
Sorry, maybe just miss some information. I know WOAH is open for all the worldwide. The point is maybe for the industry or a company want to access, not like a private, just access on the website. I mean, can have some cooperation to provide their their limit to access the base to connect with their service. That's my point. Thank you.
I can take the discussion with you directly, so we can fine-tune exactly the needs. But in general, I can say that we are working towards facilitating access of the information in regards to the different stakeholders. So, yeah, of course.
Okay, let's move on. Now I'll give the floor to Argentina.
Gracias, señora presidenta. Y
Thank you, Madam Chairperson. First of all, congratulations. I commend you for this presentation. I would like to speak not so much about WOAHs, but rather about what my Chilean colleague said regarding the time needed for checks, verification. I would also like to talk about the time for the validation of self-reporting. We are usually talking about 2 weeks, but we believe that this time could be shortened, and especially because there is a feedback time, and normally in the trading sector, everything should be as fast as possible. Trade wants things to be restored as quickly as possible. So I think we should be able to shorten that time so that we can go back to trade as quickly as possible. Even though the reporting is not published, the trading partners have trouble waiting. So maybe we could shorten the time, so the validation of the self-reporting process and the restitution. For Argentina, avian influenza, well, it's routine now. Once or twice a year, we submit a notification. The presentation is always the same. So we believe that the time needed for notification should be shortened, and that would help. Thank you for your comment. We take it in consideration.
Just checking, I have a request here from Uganda.
Thank you very much, and thank you, presenter. From Uganda, I want to appreciate the WOAH for the work you're doing, highlighting AMR, and we have already requested for rabies PVS. Thank you for accepting, and we are going to work with you. We are also going to request for close relation to be supported on the veterinary council or the statutory body for the veterinary services. My minister, Honorable Bright Ramirama, is asking the question of how we are dealing with the trypanosomiasis and SESE control. He thinks that this might be a burden that it really requires to be looked at and prioritized at the World Organization for Animal Health level. So he has asked me to talk about it in this forum, that we need to find ways, because this is a silent killer, and whatever efforts have been done at levels of countries to push away the SESE fly, you know that slowly it will come back. So he has asked me to relay this particular message on how WOAH should support in the dealing of SESE fly control, and especially that disease that is transmitted, trypanosomiasis. Thank you very much.
Thank you, Uganda. You want to answer? Yeah.
Thank you very much for the comment from Uganda, and I'm very happy to say that we are working on trypanosomiasis together with the FAO. We just recently updated a policy brief in regards to trypanosomiasis. We would be happy to share the work that is being done. And of course, we will commit to keep working on it. Thank you so much.
Thank you. Now give the floor to Mozambique.
Good morning. Sorry, I'm trying to back to my small words I prepared for this intervention. Dear Madam President, Director General, distinguished delegates, ladies and gentlemen, Mozambique aligns itself with the statements delivered by previous speakers and by the African group in particular. And wish to thank Jenny and the entire WISE team for the very comprehensive and informative presentation delivered on the global animal health situation and important role of WISE in strengthening global animal health governance. We highly appreciate the continuous effort being made to improve transparency, harmonization, interoperability, and timely reporting of animal disease. The presentation clearly demonstrated the importance of a reliable and complete reporting system and supporting early warning, risk analysis, preparedness, and coordinated international response. Mozambique particularly values the emphasis placed on strengthening surveillance systems, diagnosis capacity, data quality, and timely notification of transborder animal disease, such as foot and mouth disease, African swine fever, and highly pathogenic avian influenza, which continues to pose significant risk to animal health, food security, trade, and livelihood. Mozambique is, in fact, affected of this disease. We don't also, we want to highlight also the support by the WOAH organization provided recently to Mozambique and to control rabies by donation we receive. At this same time, Mozambique wished to express and concern regarding the low level of notification and reporting of aquatic animal disease global, a challenge that is also faced by many developing countries, including mine. This is really a big constraint. Strengthening aquatic animal health surveillance, diagnostic capacity, technical expertise, and reporting mechanisms remain critical, especially considering increasing importance of aquatic fishery resource, food security, and international trade. In this regard, Mozambique highlights the needs of enhanced technical and financial support to member countries to strengthen aquatic disease surveillance system, laboratory capacities, and reporting tools, including training, digital infrastructure that can facilitate timely and complete notification through WISE. We also commend the initiatives aimed at reducing duplication of reporting and improving integration between regional and global systems, while recognizing the challenge faced by the member countries in terms of resource, technical capacity, and change management. Mozambique reaffirms its commitments to continue strengthening national reporting system and collaboration with WOAH and member countries in supporting and support all of more resilient, transparent, and efficient global animal health information system under the One Health approach. Thank you, Madam.
Muito obrigada. Thank you very much to all delegates for your huge engagement in this session. In fact, it was a very important discussion, and I'm very happy for all the positive contributions that you gave. And I want to ask Jenny if you want to say a few words before ending.
I would just like to thank you, as always. It's a collaborative effort, a team effort between us and you, and I know we're all working together to improve the quality and quantity of reports to work towards WOAH's aim, and we do want to prevent the spread of transboundary diseases, improve animal welfare, and look to maintain global food security. I think that's what we're all working for, and I thank you for your contributions and my team as well. Thank you all.
Happy to give the floor to our Director General.
Yes, thank you very much. I also want to thank Jenny and the team. Also want to thank all focal points of the members, maybe some in the room, and just say that we have heard your call for more training, in particular focal point, for advocacy around transparency, and for more interoperability. And we are particularly heard about Africa. Thank you very much.
Thank you so much. We can do better. We are very aware of that, but we are in a very good way. So thank you once again, Jenny, for you and your team. And now, distinguished delegates, this will conclude the morning session. We now will break for lunch, and I wait for you here at 2:15 p.m. And be aware that we will need quorum. We have lots of votes to do during the afternoon. Have a nice lunch.
Par exemple, là, moi j'engage.
Si
Hop,
là,
ça l'éteint.
Distinguished delegates, good afternoon. We will now start this afternoon works, and we will now begin with the first administrative session for this general session. We are starting only now because now we reach quorum, so thank you for that. This session, this first administrative session, will be comprehending by three main blocks. The first one is the report and recommendations of the Governance Review Committee and the related resolution. The second one would be the financial reports and their corresponding resolutions. And third, the institutional matters and related resolutions. So, given the importance of the topic that are going to be addressed, some institutional matters can, in fact, and some related resolutions may need to be finalized during the second administrative session. Let's be aware of that. So we will begin now with the report of the Governance Review Committee, and I'm very happy to give the floor to Dr. Modi-san, the delegate of South Africa, to present the report of this very important committee and to introduce after that the related resolution. Dr. Modi-san, you have the floor.
Thank you very much, Madam President. Good afternoon, colleagues, Excellencies, distinguished delegates, and esteemed colleagues. It is both a privilege and an honor to address the Assembly on the work of the WOAH Governance Review Committee. We commonly call it the GRC. I had the honor and the responsibility to chair the Governance Review Committee, and thanks for your confidence in me. The GRC was tasked to examine WOAH's governance structures and to provide recommendations to the Assembly to ensure that the WOAH's governance processes and legal texts are fit for purpose now and also in the future. This is mainly because of the international governance issues that we all know have been evolving, and we also had to make sure that the transformation of our organization, the WOAH, is modernizing all the issues related to its operations, this being with the objective of treating our members with dignity and then also with honor, to make sure that we are all relevant. For me, it is an honor for me to share the progress of this committee, or the committee has made up to so far, including the 7 recommendations of the WOAH. And on the slide, it was just a display of how we will go about to cover the issues that we have in our report. We may remember that in 2024, there was an Assembly Resolution 12 established the GRC, which composed of 16 WOAH members, and these members have been ably supported by the Secretariat at headquarters and also in the regions. The GRC's work has been member-orientated and will continue to be member-orientated and inclusive by its design and ways of working. The committee conducts regular regional consultations to ensure broad member engagement and also input from the members. And then all WOAH delegates can access GRC documents on the delegate portal. And through this approach, the GRC advises the Assembly on a unified governance framework for all WOAH members, drawing on inputs from their regions and analyzing collectively as a group. On the issues of governance, currently, the GRC is in the first phase of its work. In this phase, the GRC is expected to present its package of recommended changes to WOAH's governance arrangements to the Assembly. Today, I am presenting the 7 recommendations to you as set out in the draft resolution number 4. I believe you all received draft resolution number 4 of 2026. This work builds on the 21 recommendations outlined in the consultants' report commissioned by the Assembly in 2024. Before turning to the 7 recommendations, let me first highlight that the committee is making steady progress in implementing the Assembly's specific requests under resolution number 5 of last year, 2025. As requested, the GRC has identified measures to increase financial transparency and recommends that the Assembly request the Secretariat to develop appropriate transparency arrangements. This forms one of the 7 recommendations proposed for approval today. With regard to improving the appointment process for members of the specialist commissions, the GRC conducted a thorough review of the current procedures and identified a number of gaps and inconsistencies. However, it was not able to finalize the textual changes for its recommended improvements in time for the general session, for this general session. The GRC will therefore continue its work with further proposals expected in May next year. Turning to the documentation of WOAH standard setting processes, the GRC has tasked the Secretariat with developing a WOAH's technical procedural manual. This work will be carried out in consultation with the specialist commissions and will aim to comprehensively capture all WOAH's technical decision-making processes. A first draft of this manual is expected to be shared with members in next year in 2027. GRC submits 7 recommendations on financial and institutional governance changes to the Assembly originating from the consultants' report. These recommendations were developed by consensus, reflecting the constructive engagements of GRC members and the input of WOAH members. Each recommendation is accompanied by an implementation plan, setting out the timeline as well as the potential costs and savings associated with each action. I also wish to highlight that an updated draft resolution number 4 was issued this past Saturday, incorporated a limited number of targeted revisions proposed by the GRC and endorsed by the Council. These changes include the inspection of a new paragraph 11 and amendments to paragraph 15. They are intended to improve clarity and facilitate implementation without altering substance of the resolution. Let me now take this time to explain the recommendations as reflected in draft resolution number 4, starting with financial governance. In paragraph 13 of the draft resolution, it is proposed that the Assembly decides to approve the 7 GRC recommendations. One of these recommendations includes measures to enhance financial transparency as requested by the Assembly in resolution number 5 of 2025. As one of the proposed measures, the Secretariat is developing a public-facing dashboard showing member-level contributions, including income due, received, and arrears. This will be integrated into a new interactive financial page of the WOAH's website, explaining clearly how WOAH is funded by members and partners. Paragraph 14 and 15 in draft resolution number 4 of 2026 reflect the GRC's recommendations to facilitate a consultative and analytical process on the possible revision of WOAH's self-selection statutory contribution model. As outlined in paragraph 15 of draft resolution, the first step proposed by the GRC would be for the Assembly to request the Secretariat with the GRC's oversight to carry out analytical and consultative work. The analytical work would be supported by transparent reporting and detailed impact assessment for members to ensure fair and sustainable outcomes. The first step envisages engagement of WOAH's members to assess and provide inputs on the budgetary and potential policy implications of alternative contribution models, including consulting with your ministries and other relevant authorities as required. And if agreed by the Assembly, this evaluation process would be the first step of gradual, sustained transition to any revised statutory contribution model. The GRC report to the Assembly set out phased implementation pathway to undertake this work. Should the Assembly decide in future, the new model, including its transitional arrangements, could then only apply for the organization from 2030 at the earliest or in later years, depending on progress that shall have been made. GRC also recommends that the Assembly clarify and strengthen the sanctions framework for members in arrears to safeguard WOAH's financial sustainability, promote equitable treatment, and improve budget predictability. On institutional governance, the GRC recommends allowing specified members of delegation to speak and vote in Assembly sessions, subject to the clear authorization of delegates to provide greater flexibility for delegates during the general session. Regarding the regional commissions and bureaus, the GRC recommends to modernize their functions and update the composition of bureaus to strengthen regional ownership, improve a two-way communication, and support more responsive governance. The GRC further recommends replacing the position of past president to an ordinary member position of council. You may remember that we used to have the past president staying on in the council. So we are recommending that this position be amended to an ordinary member. Finally, the GRC recommends updating the organization's approach to improving cooperation agreements by introducing a three-tier risk-based model to enhance efficiency, clarity, and transparency. In addition, colleagues, there are other proposals that have been discussed since 2025 and in 2026, which will continue this year and next year in 2027. The GRC has reached agreement in principle on 7 other topics, but the GRC has decided not to present this now, but to defer these topics to a later session to continue to assess interdependencies. These are listed in a third column on that slide. The first and second columns are the topics on which the committee's review are not commenced, or active discussions are ongoing. And these are 8 topics in total. The GRC therefore proposes updating the GRC work program timeline so that its phase 1 is extended until May 2027. This extension will allow the GRC to continue structured consultations with members and regional commissions and its review ahead of the Assembly's consideration and further reforms. Paragraph 16 of the draft resolution 4 highlights the importance of engaging WOAH members in this process. Obviously, regional consultations play a role in this regard, offering members a structured opportunity to contribute directly to the work of the GRC. At the time, discussions at the member level below allow members to draw on relevant expertise, particularly in financial and legal matters, thereby strengthening the quality and depth of contributions to the GRC work. So basically, colleagues, we are saying in terms of the consultations that you may need from the legal point of view and also from the financial point of view, if you have expertise back home, please go back and consult so that their expertise can be used to strengthen our position in terms of the work that we are doing. Just to maybe conclude, let me emphasize that this work presents our best opportunity to ensure that the structure of the organization is fit for the present and the future. DG spoke a lot about that in her presentation of the strategic plan. Our collective efforts can ensure that WOAH's contribution to animal health and welfare globally is delivered in a manner which is efficient, effective, sustainable, and inclusive. As such, colleagues, the work of the Governance Review Committee forms part of the strategic axis in WOAH's 8th strategic plan, as I said earlier. Finally, I would like to express my gratitude to my colleagues in the committee who, from the very first meeting, have demonstrated active, very active engagement. They have also demonstrated critical thinking and effective collaboration. At this moment, also take the opportunity to also thank the advisors. We can't hide them, the ushers, the Marosimolomos, the Florentias, the colleagues who have been sending us inputs in terms of discussions that have been ongoing, and the ladies in the Governance Review Committee, can call them by name. And on behalf of the committee colleagues, we look forward to working with you on this very significant work. And we know that this is very ambitious for us to try and modernize our governance issues. But we also believe that it is a very significant work. We have amidst us the consultant. I saw him coming in, Elko. And then we also have the secretariat who will assist, respond to questions that the Assembly may have as I hand over to the President. Thank you.
Thank you very much, Dr. Modisan. Thank you a lot for the important work that you conduct here in this Governance Review Committee. And before putting the resolution for adoption, I open the floor to hear your comments or any questions that you may have. Austria. It's not, okay. Give the floor to Austria, please.
Thank you, Madam Chair. I speak on behalf of the region of Europe. I would like to thank the members of the Governance Review Committee for the work done to date. The region of Europe welcomes the present report and supports the measures provided in Section 2 and 3. The adjustment of the work plan with the extension of phase 1 of the GRC is also expressively supported. It is important to focus the discussion on the essential challenges of WOAH, as these discussions will form the basis to make WOAH fit for the future. From this perspective of region of Europe, it is particularly important to concentrate on and prioritize the work on this essential functioning of WOAH and to strengthen it in such a way that WOAH can respond quickly to the changing global circumstances. This includes the clear definition and description of the executive tasks that the WOAH Council will be assigned, as well as a deep anchoring of work in the regions. It is also necessary to develop a modern, transparent, sustainable, and comprehensible statutory contribution system. With a solid basis, the scientific-based development of technical standards can also be continuously improved in the future. A particular concern of the region of Europe is that through WOAH, it is also ensured that all delegates can actively participate in the future work. The region of Europe expressively welcomed the proposed slight amendments made to Resolution 4, and I can confirm the support of these amendments. In conclusion, on behalf of the region of Europe, I would like to express special thanks to Dr. Modisane, who since the beginning of the GRC has tried with great patience and sensitivity to achieve results on the important issues. The present report shows that he has succeeded in this. For that, a heartfelt thank you and a wish to Dr. Pipis and Dr. Cookson much success in the upcoming 2 years. The region of Europe will continue to actively participate in the necessary discussions in the future. Thank you.
Austria, intervention on behalf of the 27 member states of the European Union. And now I have a request from Bahamas. Happy to give you the floor.
Thank you, Madam Chair. I am requesting for the representative of CASWA to give an intervention on behalf of WOAH delegates of CARICOM.
Sorry, I didn't. Can you repeat, please?
I'm requesting that the representative from CASWA give an intervention on behalf of WOAH delegates of the CARICOM countries.
Okay, okay, just for me to understand it correctly. Yes, yes. Okay, upstairs. The lady upstairs, yeah. Thank you.
Thank you so much, Madam Chair. I am Nika Hull James of the Caribbean Agricultural Health and Food Safety Agency, CAFSA. On behalf of the 11 WOAH delegates of the Caribbean community, CARICOM, the Bahamas, Barbados, Belize, Curacao, Guyana, Haiti, Jamaica, St. Lucia, St. Vincent and the Grenadines, Suriname, and Trinidad and Tobago, we commend this critically important work of the WOAH Governance Steering Committee. This body of work reflects WOAH's commitment to continuous evolution and maintaining relevance within an evolving global environment. The member states of CARICOM are diverse in geography, population size, and economic capacity. This diversity mirrors the broader reality of WOAH's global membership. We therefore support the recommendation to review WOAH's fee structure and to ensure that the assessed contributions more accurately reflect the economic realities of the member countries. We believe that a more equitable and economically responsive approach would support broader participation of all WOAH member countries and better recognizes the realities of small island developing states, thus supporting equitable participation among the diverse membership of WOAH. Further, we actively follow and promote the engagement of the WOAH delegates of CARICOM in the upcoming discussions on financial governance, which are scheduled to commence this year. At the Caribbean Agricultural Health and Food Safety Agency, we have been entrusted with a mandate following the special meeting of agriculture on the Council for Trade and Economic Development, COTED, of CARICOM, to facilitate the process for all CARICOM member states to become members of WOAH, specifically Antigua and Barbuda, Dominica, Grenada, and St. Kitts and Nevis. Universal participation of CARICOM member states within WOAH remains important for strengthening regional animal health governance, emergency preparedness, safe trade, and implementation of international standards. We thank WOAH for the support provided to the Caribbean thus far in advancing this process, particularly Dr. Francois Kaya and the regional and sub-regional representation, past and present, who have actively engaged our CARICOM Committee of Chief Veterinary Officers meetings and provided valuable guidance and support. CARICOM, the Caribbean community, remains committed to the advancement of animal health across our region, and once again, we commend the Governance Steering Committee for this excellent work. Thank you.
Thank you. I thank Bahamas for the intervention in name of the Caribbean countries. Now I'll give the floor to Argentina.
Muchas gracias, Presidente.
Thank you very much, Mr. Chairman, Director General, members of the Council and delegates. I'd like to thank Mike for this presentation. In 2024, the World Assembly of Delegates asked for a revision committee to revise the current perspective and governance of WOAH in order to introduce reforms that meet the current and future needs of WOAH. With the Americans, delegates of the Americans, we closely followed up the progression of this work, and we are very happy with the commitment and the involvement of all delegates, experts, and assistants. And for this reason, Mrs. Chairman, I'd like to recognize on behalf of 33 countries of Americas and the Doctor of Canada, Chile, Byron Hill. I would like to thank the team of the central headquarters, Franco Iscala, and above all, Francisco Alegio, for the regional representation of the Americas and their team for the support in this work. And to finish, I would like to commend WOAH and all expert delegates for working further on these processes to consolidate a modern, efficient governance that meets the needs and challenges in the future and today.
Bongo.
Merci beaucoup, Madame la Présidente.
Thank you very much, Mrs. Chairman, for giving me the floor. I am speaking on behalf of the Democratic Republic of Congo for the ongoing work. This work leads us to think further. And the first idea is about the wealth of the consensus. I mean, this work at a greater scale was about finding consensus. I know that the Medicine groups and all our delegates meet us from time to time to try to have our advice and opinion. But it is true that this work is time-consuming. And now we've had gray hair, and we're kind of scared of time that passes. And we thought, OK, first phase, 2025, 2026, and then postpone until 2027, and then 27, 28. So first point, it's good to postpone, but I think we have to speed up the process. Otherwise, my hair will get more and more gray. We want change to happen while we are around. That's my first point. Second point, there are two key aspects. First of all, the structures in which we work. These structures should be able to develop. I'm not talking about individual development. I'm talking about, improvement in quality and representativeness. But outside of this, there's also a budget issue. When you start talking about money, Africa, as you know, unfortunately, is going through major difficulties. And when people speak, there's always sort of start feeling bitter. I think that these people are not behind me, are not following the rules. So we're talking about structures, and we're talking about money and contributions. So for this contribution, it's always the same answer. But we are progressing, and at the same time, we're not really progressing. So with the text revision, maybe we could all agree on a minimum possible minimum. That's the comment I wanted to bring to your attention. Thank you very much.
You want to comment? After? Okay. Okay, let's proceed. The request from Omar.
Thank you, Madam Chair. I have the honor to speak on behalf of the member countries of the WOAH Regional Commission for the Middle East. At the outset, we would like to express our appreciation to the members of the Governance Review Committee for the important work undertaken thus far, and for the constructive and inclusive approach adopted throughout the review process. The Middle East region welcomes the progress reflected in the current report and supports the continuation of the governance review process, including the extension of Phase 1 to allow sufficient time for comprehensive consultation and consensus building among member countries. Our region believes that the ongoing governance reform represents an important opportunity to further strengthen WOAH's effectiveness, responsiveness, and transparency, and institutional reformation considering evolving how global animal health challenges are globally managed. In particular, the Middle East region underlines the importance of ensuring equitable regional representation and participation in WOAH governance structures, strengthening Council's regional and sub-regional representation role in supporting WOAH and its member countries, maintaining transparency, fairness, and diligence as regards each member fulfilling their statutory contribution obligation, and ensuring that all member countries are able, regardless their capabilities, to actively participate in WOAH activities and decision-making process. The Middle East region stresses also the importance of preserving WOAH technical and science-based mandate while enhancing operational efficiency and institutional flexibility to address emerging and transboundary animal diseases, food security challenges, and One Health priorities. Furthermore, the Middle East region appreciates the efforts undertaken to improve information exchange, dialogue, and consultation with member countries throughout the governance review process, and encourages all regions' engagement in ensuring broad members' active involvement and contribution of ideas and support for balanced beneficial outcomes. In conclusion, the Middle East region expresses its appreciation to the chair and members of the Governance Review Committee for availing themselves and their personal time, and for their efforts, dedication, devotion, determination in advancing this important task they have been endued. Reaffirm our commitment to constructively contribute to the ongoing discussion and future work for WOAH, future evolution and reformation. Thank you.
Thank you, Oma. And United States, floor is yours. Where are they? Chile. No, but you have... It's here. Yeah.
Thank you. I speak on behalf of the Animal Health Quadrilateral Alliance, comprising Australia, Canada, New Zealand, the United Kingdom, and the United States. We reaffirm our strong support for the work of the Governance Review Committee in modernizing and strengthening WOAH's governance to best support members and advance global animal health. We recognize the ambitious scope and complexity of this work and thank the committee and the Secretariat for their continued dedication, including managing the extended time frame. We encourage continued engagement by all members through their respective Regional Governance Review Committee representatives and value the support the Secretariat and regional WOAH offices have provided in assisting regional consultation to date. We support further involvement of the regional offices to help socialize and clearly communicate matters under consideration by the Governance Review Committee and help solicit feedback from members. Moving forward, we highlight the importance of the Governance Review Committee prioritizing and working on potential governance changes that are likely to be the most impactful and strategically important to WOAH and its members. Thank you.
Thank you, United States, and I'll give the floor to Chile. Here.
Gracias por la oportunidad.
thank you for giving me the opportunity to speak. I would like to say that democracy areas have to be managed. They have to be sort of well taken care of, and we've all been thankful, we've been congratulated, but we have to talk about those who are not here. For those who could not attend, we have to be able to find them and find out about their views and opinions, because at the moment there are very few resources, very little budget, and this should not be a constraint and should not be a reason not to listen to the people who cannot attend. The idea is to find innovative ways and find the opinions of the people who are not attending, opinions on AI. We have AI, social media, tools that facilitate communication and dialogue for people who cannot attend physically. And I'm asking, and hopefully at the next WOAH session, they will have a full representation with everybody attending. And I'd like to thank Dr. Moisane for these processes. And I'd like to congratulate the new chairperson, and I wish you a lot of success.
Empty spaces, but I just would like to highlight that we have 113 delegates, so we have quorum to have this robust discussion between us, considering the legal procedures. Any other comments or participations? Can see none. So, considering your positive comments and contributions to the process, we will now proceed with the adoption of the resolution related to the Governance Review Committee. And I propose for adoption resolution number 4, recommendations and update work program timeline of the Governance Review Committee. So, are there any objections? Any abstentions? So I'm very happy to say that there's a resolution number 4 is adopted by consensus. Thank you so much, Dr. Modison, for the presentation, for the important work carried out during the Governance Review Committee. I don't know if you want to take the floor to say some words. No? But I'm happy to give the floor to François.
Thank you, Madam President. I just would like to give some feedback on some intervention that the membership have made. We definitely got the call, which is the main call that I received from those interventions, to a broader involvement of the membership as a whole. The GRC members are definitely getting out of their zone of comfort in terms of delegate and what is usually expected from a delegate. And you have to be grateful to have those members in the GRC supporting that work. But this is not going to be possible if there's not a higher level of contribution of all the membership to make sure that next year, cross finger, when we're proposing you the final package that would lead us to new text, you're going to know what's going on and you're going to be happy to move forward for an enhanced governance for WOAH. We got the message received from Europe and also the America to be more focused in the coming meetings of the GRC. The GRC members definitely understood the importance on working on the primary bodies of the organization, the financing, and when this is going to be clear, we're going to be able to work on the rest of the aspects of the governance that need to be worked on. I welcome interventions from member states that are maybe not yet members of WOAH, but do have an interest in the work of the GRC. In the light of becoming a member, I think it's an amazing opportunity also to be inclusive in our reflection and get the perspective of those countries to the work of the GRC. make sure that we're more inclusive in our future governance. I got the point of the president of the Regional Commission for Africa, the issue of funding. True, it's a difficult situation in Africa. That being said, I really welcome the fact that already last year during your Regional Commission, you put on the agenda of your meeting the discussion about the arrears in your region. And there's going to be some more words being given in the upcoming session, but there's been already some efforts done by headquarters, but also efforts done by the members themselves to clear their arrears. And there's some members that actually gained the right to vote for this general session, including from Africa, because it took the cause seriously about the importance of having a sustainable funding of the organization. So there's already a movement which is extremely appreciated and positive. That's what I will react in general. Thank you for the Middle East for the very positive comments too. For the America as well, on behalf of the Quads Alliance as well. It's an alliance that is interesting because it's touching on 3 WOAH regions. So we appreciate this common vision that you do have. On behalf of the Secretariat, I would like, obviously, to express our deep and sincere appreciation to Dr. Modisani for having accompanying us. And as deep and sincere thanks again to the members of the GRC. We're definitely getting them out of their zone of comfort. So my words goes also for the Secretariat, because the Secretariat, it's way beyond some of the teams under me. It's a whole of Secretariat approach. There's very little departments and or unit that are not involved in the work, in providing inputs in the information papers that are shared for you to better understand the way we work and so on. The regions also are supporting your regional consultation feedback session. So it's a whole of Secretariat approach as well. And this is all to serve basically the intention that you adopted in 2024 resolution number 12 to modernize the governance of the organization. So thank you very much for that. And now my thanks is to you, the Assembly, for having adopted this resolution. It's a sign of trust to the GRC, to the Secretariat, and we'll do our best so that next year, phase 1 will be finished, and you will adopt a package that will lead us to a better governance text in the future. Thank you very much. I thought it was said, but I will mention it and thank them. Dr. Modisani is leaving us as a chair, but we have some succession planning that was lined up last week. So the new chair would be Dr. Pipis from Cyprus, who was vice chairperson. And the new vice chairperson is Dr. Beth Cookson, Australia. So I thank them for also providing their leadership for the upcoming year.
Thank you so much, Dr. Modisan, and congratulations for the new leaders of this process. And for future memory, I also want to make a remark, because Austria spoke on behalf of the 53 countries of Europe and not on behalf of the 27 members of European Union. Apologize for that, Ulrich. Clarification is made, and it's even better. So let's move on, distinguished delegates. And now we are about to discuss the financial section of this administrative session and proceed with the presentation of the 2025 financial report. And for that, we will have here on the floor Dr. Marie Alison. And we would like to hear from you. Please, you have the floor.
Thank you, Madam President. Dear Director General, señoras y señores delegados.
My dear colleagues and delegates, thank you very much for being here today with us. I'm very happy and I'm honored to present for the first time the financial results of WOAH. My Spanish is quite limited, but I wanted to start this presentation in Spanish to greet you and also to thank you for your attendance. And now I'll switch to French. Ladies and gentlemen, dear delegates, I guess you're as impatient as I am to hear the financial results and the adoption of the associated resolutions. So it's the first time for my part, for the organization, it's the 100th time. So I'd like to take the opportunity to thank all the teams who made these financial reports and figures possible. So today we are going to present the resolutions. Can I have the slides, please?
Qu'est-ce qui me passe là? Voilà. Donc nous allons vous présenter les.
We are going to present the financial results of the 99th financial results for the year 2025. Then you will hear the auditor and the external auditors who will give their opinions on the results of the year 2025 until I give you an update for the financial plans for 2026 and the 2027 budgeted work program and the technical changes on the staff rules. So first of all, I would like to announce the online adoption of resolution number 11 that acknowledges the contribution of members and partners. It was submitted to online votes, and we thank you for your participation that led to adoption under the following results. The resolution was adopted by 106 voices for and 1 abstention and 1 no. So thank you for your participation in the vote. We are looking forward to the resolution of this adoption. So now the financial report for the year 2025. So it starts with a presentation of a consolidated financial results. So consolidation, so to the income of 52.2 million with expenses at 50.9 million euros. And in the presentation, you can see the major weight of the World Fund to fund the activities of the organization, the major share of statutory contributions of the members and the low contribution of other resources of the organization. The expense level is consistent as in the previous years with a strong share of activities and a stable staff cost. Guatemala, and thank you for this, stress the fact that with little money, WOAH does a lot of good. So now I will dive in the details of the expenses for the year 2025 and according to a consolidated approach. So we aggregate the results of the general budget, of the representations and the World Fund. So consolidated financial statement shows the clear share of the World Fund to finance activities and stable resources in the general budget. The budget for representation is mostly financed by the World Fund resources, but it's a strategic activities, and it's been clearly demonstrated by your inputs and interventions over the last few days. Management rules. According to management rules, there should be a separation of chapters per region according to general budget and according to the fund per category. We noted that the prevalence of the funding of the World Fund make the deployment of these activities feasible. So it's fully our expenses, aggregated expenses, comply with this balance, and they are a clear reflection of all our activities, since half of our expenses is supported by the World Fund. And so when we introduce our expenses according to budget units, so it's very clear it's that the global framework that accounts for most of the expenses is the biggest share, with 36% of expenses. So it does reflect all activities and operations that were mentioned over the last few days. And this clearly shows the significance of the new organization that was devised last year with a dedicated general management that is dedicated to the global framework. Secondly, information management that is clearly reflected and shows all efforts that have been made to share information with the members, or on our discussions this morning on WOAH clearly illustrated the strong commitment of members with regard to information sharing, which is one of the core missions of the organization. And I'm very proud to show that the administration is very consistent and coherent with comparable organizations. Then the general budget was submitted in March. It's been online for 60 days now, so some of you, as I can assume, had the opportunity to review it. Just a few landmarks. That's the distribution of members according to the contribution category. So on the map, you can see all the efforts of the member who contribute to the organization's activities. So this reflects the situation on the 31st of December 2025, so it does not cover the commitments that were made by some members since the start of the year. So the income per category, almost 15.8 million euros for 2025, and the members appear in all the categories that you can see here. We have an overall total of statutory contributions, 18.82 million euros. 882, sorry. So the stable increase reflects the indexation of contributions on the general prices level according to OECD. So the renewal of 84%, 84% of the 15.8 million euros in income were paid to us, and this rate has remained stable in time. It's fully compliant with the rate of comparable organizations, but it's still showing losses of almost 2.5 million euros. That reduces the capacities of the organization and the predictability in resources. In this regard, GRC produces a lot of work in order to modernize the calculation methods of the contributions. So the recovery of arrears, as you can see here, it is distributed in various categories. Members with 1 to 4 years of arrears, those 5 to 11, after 5 years of arrears, you're no longer allowed to vote. So there's a homogeneous rate for countries with 1 to 5 years of arrears, and it's a bit more concentrated beyond 5 years of arrears. So quite understandably, members with arrears are members from category 6 or less advanced countries, as explained during the general session 2025. Dr. Soubirand, Director General, initiated the recovery of arrears in statutory contributions. Specific measures for follow-up identification of members with arrears were initiated, and targeted and specific messages were sent to the members to ask them to pay their contributions. The Director General, during travel, also personally committed towards the authorities, and this did translate because these results were recently updated, and this week we received contributions from members who have cleared their arrears, and we thank them for their commitments, and we congratulate them for paying and clearing their arrears. And we've implemented recovery plans that allowed countries in difficulties to pay their compensations, to pay their contributions in a suitable framework that complies with their own financial constraints. On top of this, extraordinary contributions were paid by 3 members in 2025 on a constant basis in time, as you can clearly see from the presentation.
Donc globalement, nos revenus 2025.
Overall, the 2025 income was in conformity, is compliant with the amounts approved last year, and the adjustments are due to the fact that some projects were moved in time, and therefore the call for funds was postponed, and the amounts were postponed to the next year. We also have a few changes on investment income because we had reached a deadline of some investments, and actions were taken to fix the issue for the next fiscal year. The expenses are slightly lower than the forecasts, and the adjustments are mostly due to meetings that were not held in 2025, as well as the fact that some of the WOAH phases were postponed, and we've already discussed that. As we can see, there is a deficit in the funding of regions and sub-regions. We are paying attention to that particular item due to the fact that this has a very high strategic importance with regard to the service provided to the members. For 2025, the positive result is 218,000 euros, which were paid into the reserve fund. And we have a slightly positive balance. This is the budget for the general budget, and we are taking in consideration amounts that were provisioned in order to anticipate for possible depreciation that could happen in the various regions. I would like to highlight for the Assembly that this result is close to 97%, 98% of the general budget. This is a very high consumption level, and I encourage the Assembly to be a bit more careful and cautious in the future so that we can face possible unexpected emergencies or situations. We also have the World Fund resources indicators for 2025, quite encouraging actually, because the World Fund during the 2025 year reached the highest ever level of contracts signed. 33 contracts were signed in 2025 for 24 million euros total amount, and we therefore have 153 million euros as active grants. The income received per annum, which is the 2025 fraction of contracts over several years, is 23.83 million euros. This is a consistent amount and a very good amount if we consider the international context and the activities of the World Fund. We have made big efforts to make sure that these contracts are sustainable. Now, interestingly, if we look at the typology of the resource partners, in the first box we have a very specific typology of partners. What I mean is that the members usually represented 75% of the World Fund resources, but nowadays we have reached a balance between the international organizations and the members in the contribution made to the World Fund and the number of contracts, grant contracts signed. The expense level, 31.4 million euros, shows how intense the activities supported by the fund have been, and this shows the commitment. 30 million euros expense means that the general budget covers 60% of the overall expenses, the overheads of the organization, and this amount shows the essential role played by the World Fund as a multiplying factor for the organization activities. Now, the breakdown of the financial performance, the expenses here shows how complementary the two funding sources are. We have, on the one hand, the World Fund resources, which cover the overall framework, global framework activities in such a way that the organization may organize strategic, political, and institutional activities in such a way that the operational capacity can be supported. Overall, if we consider all the actions carried by the World Fund, we see here all the funding institutions who provided the support during 2025. We are now going to talk about regional and sub-regional representations. Again, we see the huge fund carried by the World Fund, 74% of the region funding, 3/4 of the resources are covered by the fund, and the statutory contribution paid by the members are insufficient to pay for the activities supported by the organization. The GRC activities are complementary and they allow us to reach a balance and guarantee sustainability of our funding over time. However, the breakdown of the expenses is consistent with the rest of the organization, shared between the salaries and the other operations. We have a very high activity level in all the activities carried by the World Fund. In conclusion, regarding the 2025 general budget, regular budget, we have a balanced budget. The balance is slightly positive. We have 1% of positive balance, and the execution rate allows us to confirm our cautious approach, and it confirms the need to be even more cautious to guarantee the budget sustainability. Before we give the floor to the Council auditors, I will happily answer any questions you would want to ask me.
Thank you for this presentation, and I open the floor for comments, if any. I can't see any comments. Dr. Emmanuel, you want to say something?
No, just maybe highlight what Mary said on the areas. Indeed, maybe you remember last year general session that at that time I made a personal commitment because we had some quite lively discussion about areas. So I made this commitment to really reduce or work on the areas. So as Mary said, over the past year, I have engaged in numerous discussions on this issue with authorities that I have met, and also with ambassadors in Paris. And I think it is a work that will take time, but we were very happy to see some result this year because, as Mary highlighted in her presentation, we are this year at this general session we have 10 countries less in areas. So countries in areas went from 63 to 53, and we have for those who lost their voting rights, we have 4 countries less, so from 37 to 33. So it's first result. It's not. It takes time. I think it will take time, and but what I want to tell you is that we will continue in this work and continue to help the delegates of this country, which I'm sure would prefer to come at general session without areas. We will continue to help them to be able to solve this issue. Thank you very much.
Thank you very much for your positive message. And now it's time to invite Dr. Masao Kita, delegate of Japan and member of the Council, to present the report of the auditors of the Council. Yes, okay, it's, I have information it will be Dr. Juarez and not Dr. Rukita, also member of the Council. Go ahead, a pleasure to give you the floor.
Gracias, señora presidenta, doctora Susana Pombo y señora.
Dear President, Dr. Susana Pombo, Madam General Director, dear colleagues, members of councils, I'm going to introduce the report by the auditors for the fiscal year 1st of January to 31st of December 2025, prepared by Dr. Kita, Delegate of Japan, and myself. As Marie explained, we have looked at all the financial aspects regarding the 2025 fiscal year. We determined that the annual accounts, the accounting books, and all the documents we were given show no irregularities. The accounting book and the auxiliary books regarding the general budget, the regional representation accounts, and the accounts regarding the sub-regional representations, as well as the World Fund accounts, or balance of the World Fund for animal welfare and health within WOAH. The accounts in Japan and the savings account for the regional and sub-regional representations were validated by the General Director and the accounting department manager. The financial resources coming from statutory contributions and voluntary contributions, as well as financial investments, were exclusively dedicated to funding the work as foreseen by the work of the working groups shown by the administrative manager, and the budget was adopted by the Assembly. As the auditors, we therefore confirm that all the items have been complied with, and that the 2025 accounts show a positive account of 218,000 euros 50. Income is 7,740,000 euros, and the amount is lower than the 372 million euros as per provisions. The expenses are 20,581 euros and 50 euros, and they are lower than the 580,000 provisions that were set aside. The recovery rate for statutory contributions is stable versus the previous years and slightly lower than 2024. In spite of efforts as described by the General Director, there have been progress made since in such a way that all the members pay their arrears. In December 2025, 35 members had arrears in their contribution payment, ranging from 1 to 4 years and 5 to 11. The provisions with regard to arrears for the same period amount to 5,630,821 euros. The General Director has explained this in detail, and she will continue working with the members so that all the arrears are paid in adequate conditions. The Assembly is fully supporting the General Director's efforts, and this particular item, on this item, all the delegates from the countries should endeavor to solve the arrears issue. The regional and sub-regional and World Fund account, as well as the savings and pension fund for all the regional and sub-regional representations and the WOAH offices were duly managed in a satisfactory way, and there is no specific abnormality to be mentioned. The reserve fund represents several months of operating mode, and the accounting system is also appropriate. The financial report by the General Director is showing a reliable image of the way the accounts were managed. The accounts were well managed in a cautious way. And I would like to highlight that some representations show financial vulnerability and excessive exposure to funding risks. This fragility could have an impact on the original credibility of the organization. In 2025, following the study conducted in 2023 on 2 pension funds, the pension complementary account and the current pensions account showed that we need to continue working and analyzing these accounts, and the headquarters should represent the regional representations. We therefore encourage all the members to think about moving to a higher category in their statutory contributions, or else they could also choose to pay an extraordinary contribution in such a way that WOAH will be able to increase its presence in some regions such as Africa, because we all know that Africa's financial situation remains very fragile. Based on everything that was said, and as the statutory auditors, we recommend to the Assembly that the number 12 resolution draft, which covers the financial report, be approved. Thank you very much.
And thank you also to Dr. Rokita for this very important information that you provide us. Any comments from the Assembly? Okay, I can't see any, so I now invite Mr. Didier Selles, External Auditor, to present the report of the External Auditor. Please go ahead, you have the floor.
Merci, Madame la Présidente. Madame.
Thank you, Madam Chairman. Madam General Director, ladies and gentlemen, dear delegates. Just to reassure you, I'd like to say that in 2025, WOAH has a sound financial situation which has been well managed. Like in 2024, WOAH confirmed in 2025 that its financial situation was sound, that the management was sound, and that progress has been made with regard to controlling the risks. We made positive observations on both the accounts and the management. The 2025 budget was complied with in compliance with the financial regulations, and the financial statements are complete, transparent, and consistent with the accounts. The treasury and the inventories are reliable, and the internal control was reinforced in 2025. Therefore, we make nothing but positive observations. And now, if we look at the main characteristics, I would like to underline a few items. WOAH has solid resources, but still fragilities are remaining. Robust funding, because the contributions have been shown in the previous presentations. 84% of the contributions were paid during the 25 budget fiscal year, and 91 if we include arrears. However, arrears, unfortunately, are still a challenge for the organization. 70 countries have not paid their 2025 contribution within the fiscal year. 43 countries have more than 2 years worth of arrears. And when contributions are not paid over 2 years, they are amortized in the account. And therefore, this amortization represents 5 million euros in 2025, which is a higher figure than in the previous fiscal years. Now, this will lead us to a discussion that was already started in the organization, as was shown by the GRC work. It would be desirable for the organization to have a more sustainable funding system based more on the state's capacity to contribute. And it is organized this way in all the other international organizations working with compulsory contributions such as WHO, FAO, the World Bank, the IFM, etc. They all have used and GDP per capita based criteria to calculate the contribution. And if we look at the breakdown in the various contribution categories for WOAH, we find that approximately 20 countries with very high contribution capacities are actually placed in categories 5, 4, 5, 6. If they were in categories 1 or 2, WOAH would have an additional funding for which is essential for its development. WOAH is an organization that wishes to modernize its organization, tools, and procedures. Several projects were launched in the follow-up of previous fiscal years, and therefore this is a new organization of our budget which is currently being experimented in some regional representations in order to have a better monitoring of the budget execution. Also, some projects have been launched for the digitalization of human resources that Mrs. Alizon has described. We're also looking at the improvement of censorship and procedures in order to control other than financial risks, but risks that have an impact on the organization. And finally, we decreased the payment time from 38 days to 34 days, but there is still progress to be made. We have our work cut out for us. The aim for the organization and all these projects is to reinforce quality, reliability, efficacy, and steering capacities for the organization. In our report as statutory external auditors, we have suggested to increase the threshold which will allow us to the organization to focus more on organizational issues. The World Fund has reached an unprecedented activity level with 31 million worth of expenses, but it also receives funding which is consistent over several years. 350 million euros of commitments towards the organization and the World Fund. And finally, as was said previously, we have a very high level of grants contracts being signed last year by WOAH, 33 in total, and that's a record. All of these observations on the World Fund for Animal Health shows that the World Fund and the organization benefit from a very good international credibility, especially when we compare it with the challenges that other international organizations are facing when it comes to finding funding. We also want to highlight a better dynamic management of the World Fund available funds. 50 million euros in 2025. We want to increase the financial products, and in some cases they will be restituted to the funding institutions or paid into the organization. The pension fund for the WHO agents, end of 2025, the amount was 21 million euros, which is a very high amount. And as Mrs. Alizon said, it might be worthy of a more dynamic management to achieve better yield. And it is recommended in the report to continue with the efforts made to improve the management fees from the different funding institutions, so 8.23%. This is the second source of income for the general budget, 2 million in 2025. Number 4, the regional representations, as you know, and as was repeated earlier, some of them have financial issues. We know why. Some countries have not paid their contributions or are late paying their contributions. In some cases, it is also because some of the headquarters agreements have not been complied with. And for some representations, it is also due to the fact that they depend on a small number of funding institutions. Therefore, the general budget covers for the deficit, and the contribution from the general budget is increasing 450 million euros in 2024, 800 million euros in 2025. This obviously decreases the profit from the positive balance of the general budget. And WOAH is thinking of reducing risks, and this means possibly reorganizing the geographical representations. And WOAH has already thought about the regional representations that are located in conflict areas, and it is possible that their location will be changed. Number 5, the wealth situation is very sound. Net assets in 2025 were high and growing, 16 million euros. Net assets are what will be left were WOAH to disappear, which we obviously don't want to happen. We have 1.2 million euro positive balance in 2025. This is a very satisfactory result, and the reserve fund is growing every year. WOAH is saving part of its profits in order to pay them into the reserve fund, and the reserve fund will be used should exceptional circumstances have an impact on our organization. In conclusion, when assessing the accounts and the management of WOAH in 2025, we find that the UMSA has a sound financial situation, growing, especially for the World Fund, and that WOAH has already started, has launched into a modernizing process for the way its accounts are managed. Thank you very much for your attention.
Didier, this is an important presentation, and it's very good to have your continued support to WOAH as an external auditor. I open the floor for comments, if any. Paraguay. I need a mic here.
Gracias, señora presidenta. En primer lugar, quisiera.
Thank you, Madam Chairperson. First of all, I would like to thank and commend the WOAH financial team for their work. For several years now, we have heard rumors here and there, and the presentation made by the Governance Review Committee is also interesting. I was thinking, because for me there are two aspects here. There is something really positive because with limited money we have done quite a lot. But on the other hand, I am concerned. I am concerned because there are still many members who have unpaid arrears. And therefore, I would like to show the example of my country, Paraguay. Paraguay is a developing country, and as many countries here, Paraguay has made the necessary efforts to move to Category 1. We don't complain. 5 or 10 years ago, our export volumes did not exceed 1 billion. Now they exceed 2 billion. And as WOAH has helped us, we want to help WOAH. We are working hand in hand. But I would like to say careful. Careful, because not only WOAH with the General Director and its teams must pay attention to recover the debts so that the financial situation improves. Countries have to pay their debts, but we delegates are also responsible, and we delegates should advocate with our national authorities in order to fix the problem and fix the situation. If we want to obtain results, if we want to have real-time, accurate and reliable information, it is important that our organization is in a position to face the current and the future challenges And, you know, future challenges are unknown. We have to be prepared for anything. And thank you very much. This is all I wanted to say.
Muchas gracias, Paraguay. Any other comments? Nigeria, please.
Je suis pourtant habituée avec mes prostituées nigérianes.
And our indefatigable Director General and her team. I stand here not only as a delegate of Nigeria, but to a great extent, members of the official delegation to this very important meeting. Today, I feel proud of this very, very esteemed organization. I say this with all sense of responsibility because most times what runs organizations down is when it comes to finances. And you can see the innovations and transparency that has been displayed by this very important august body. For me, I'm feeling happy, and I must confess, regrettably anyway, that Nigeria is one of the countries that is owing. But you can see that my minister, I think, is somewhere still around here. Hearing the transparency of this report and what WOAH is doing in terms of not just mobilizing, but effective utilization of resources, for me, it is a call to duty to all of us who are owing. We must be innovative, like the last speaker said, in supporting our esteemed group led by the President of the Assembly and the DG. Honestly, I think, like I said, I'm not going to just speak like Paraguay that have offset their debt, but I should say and confess, well, this is my first meeting, and I dare say that with the new Ministry of Livestock Development, I'm sure we are going to work assiduously with this world body to ensure that the progress that has been made are really sustained because we need a lot of funding. So once again, my minister just stepped out, but he's been following all the conversation. And I can assure you, going forward, and indeed, maybe other delegates that are defaulting, because I'm a little bit worried, the number of us that are still defaulting. How would we want to be helped by WOAH if we are also not doing our own bit? I expect that next time when we meet in this very important, during this important meeting, the number of those who are owing, including myself, Nigeria, yes, would have been reduced drastically so that we support all the great efforts that this assembly is doing, because WOAH is everywhere, supporting interventions, making life, supporting public health, and so many other things. You don't deserve less, you deserve more. On this note, I congratulate you, Madam President, Madam DGG, and indeed your entire team for doing us very, very proud. Thank you very much, and God bless all of us.
Thank you, Nigeria, for your enthusiastic speech. Any other comments? Kenya, please.
Thank you, Madam President. Kenya wants to appreciate the good work done by the financial team in sharing with us the financial reports and also the audits. The WOAH financial report demonstrates prudent institutional stewardship and growing recognition that animal health is a strategic global investment. However, the report also reveals a persistent mismatch between the expanding scope of global animal health challenges and the financial resources available to address them. For members, this underscores, on one hand, the need for stronger domestic financing of veterinary services, while on the other hand, supporting reforms that make WOAH's funding model more equitable, sustainable, and responsive to emerging global risks. Thank you, Madam President.
Thank you so much. Any other comments? I can't see any other comments. Emmanuel, you have the floor.
Merci beaucoup, Madame la Présidente.
Thank you very much, Mrs. Chair. And I would like to thank Didier Feles for his work in the organization. He's been working with the organization for 12 years. For the last 12 years, Olivier Feles has been the external auditor of the organization. Throughout these years, I'm sure you've greatly appreciated all his analysis. Since I was elected as Secretary General, I had the opportunity to appreciate all his recommendations and the discussions we've had under the external audit. And his idea is abundance, and he's always been extremely positive and very, very positive contributions. I'd like to thank Didier Feles for 12 years of serving for 12 years as external auditor for the organization.
Thank you so much. In fact, it was a pleasure to work with you and testify your professionalism only working when you are working here with WOAH. So I can see and announce you that we have quorum in the room. So we will proceed with the adoption of resolution number 12 concerning the approval of the 2025 financial report for the period from 1 January to 31st of December 2025. I propose for adoption this resolution number 12. And are there any objections? I see none. Are there any abstentions? Resolution number 12 is adopted by consensus from the Assembly. Thank you. And now let's go for the next one. I propose for adoption resolution number 16 concerning the appointment of the external auditor. Are there any objections? See none. Are there any abstentions? Resolution number 16 is also adopted by consensus from the Assembly. I have the floor.
Yes, I would like to invite Mrs. Natasha Rimbon, which is the Director of International Relations, External Audit and Francophonie at the French Court of Auditors, to on stage, because the French Cour des Comptes will be our external auditor.
Madame la Présidente, Madame la Directrice Générale, Mesdames et Messieurs les délégués.
Mr. Delegates and Director General and President, in the name of Amélie de Montchalin, the first President of the French Cour des Comptes that I am representing today, I would like to warmly thank you for your trust in the French Court of Accounts. So, as an external auditor, becoming an external auditor of WOAH is a great honor for us, and we're looking forward to this appointment, and our two organizations will work very closely. The court will provide all their skills and methods to greatly support WOAH throughout the implementation of their strategy in order to allow WOAH to achieve the goals set. Over the last 40 years, the Court of Accounts has had a very good reputation as an external auditor for international organizations. Today, the Court of Accounts is the external auditor of the United Nations, as well as the International Organization for Immigration, external auditor of the WTO, And soon we will start a new mandate as external auditor for the Organization of International Civil Aviation. The expertise of the Court of Accounts as external auditor for international organization is fully acknowledged, and our active participation in international organizations that include other auditing organizations shows that our commitment to improve audit standards and audit practices. We are very proud and happy to contribute to HAMSA's work. WOAH is a key pillar for animal health and human health on the global scale. The recent news have shown that the actions of the organizations are crucial for our daily lives, so we are determined to contribute through our mandate. So I thank you for your trust in the Court of Accounts, and I'd like to thank you for your attention.
Okay, let's proceed. Information here that you would like to... Yeah? Okay. Okay, so let's proceed now, and we invite again Maria Lison to present the adjustments to the 2026 budget work program. You have the floor.
Merci, Madame la Présidente.
Thank you, Mrs. Chair. The adjustment made for the year 2026, so 100th year. So this will be very fast because this matches the forecast that were presented to you for the year 2026. Statutory contributions amount to the figures that you can see on the screen. So as a result, the income of the organizations have reached the following level. This income includes additional extraordinary contributions, as well as the reclassification of members. The income is fully compliant with what you voted last year, but a specific adjustment was made on extraordinary contributions, and we'd like to thank the members for this. So adjusted expenses, well, everything, it is compliant with the budget that was initially presented. Adjustments have been made on the organization of some meetings and the postponement of some projects. As a result, we are fully compliant with what was initially presented. So this the presentation per chapter. So it includes the World Fund and the regionals and the regions. It's not fully consolidated, but it provides you with the widest vision of all the expenses for the entire organization of about 60 million euros. So the distribution of the scopes is fully consistent compared to the previous years, with the right chapters and constant efforts for the missions made for the missions of the organization, of the significant share of the World Fund for the implementation of various operations. There's a share of 75% of the resources of sub-regional and regional representations. 75% of these resources are supported by the World Fund. And I'd like to insist on this share, as it was often mentioned. This financing supports the operational activities of the organization and its ability to assist the members.
Donc pour cette année 2026, nous avons...
For the year 2026, we are fully in line with the commitments that were initially made. Some specific efforts were made with regard to the payroll and wage bill, and control allows us to increase the wage bill, payroll, and increase the operational capacity. And there's also a reversal of provisions for the year 2025, and it does confirm the prudential approach, so we may anticipate unexpected events. And within our budget margins, we have this ability to meet unexpected events. These are the main aspects with regard to the 2026 figures. So I may answer the questions with regard to the adjusted budget work program for 2026. Any?
No. No comments. So we have quorum, and we now can proceed with the adoption of resolution number 13 concerning the approval of the 2026 adjusted regular budget. Any objections from the Assembly? Any abstentions? Resolution number 13 is adopted by consensus. Thank you very much. We will now proceed with the presentation of 2027 budget work. Right? Go ahead, Marie.
Merci, Madame la Présidente. Vous ne serez probablement pas très surpris.
Thank you, Mrs. Chair. You may not be surprised to find out that we are talking about the 2027 budgeted work program. So we will start with the related contributions. There's been an evolution in the contribution level because we suggest we may change the threshold for category B from 300,000 in 2026 to 400,000. This change in extraordinary contributions aims at making up for the progressive evolution in categories 1 to 6 due to the indexation or indexing on pricing evolution. So these prices in indexation have been set by OECD, the price index. So the threshold of category B has been exceeded. That's why we decided to adjust the level of contribution B so that the members who wish to provide extraordinary contribution may have a broader range of options to do so. So let me remind you that this change of 4.1% reflects the evolution of the price index that is applicable to all expenses and charges, and it is based on the price index from OECD. Just for your information, as mentioned in the report, the prices evolution for 2025 by OECD, they are based on 11 months because in October OECD could not cover the comprehensive inflation rate for all the countries in this area. So for the year 2027, the estimated income is 23.7 million euros. So it's a theoretical amount based on the 100% recovery of contributions. Usually this rate is slightly inferior, but we assume that the income for 2027 will be 23.7 million, and you can see that the investment and incomes are back to the same level due to the efforts that were made this year for the management of financial assets. So estimated expenses closely follow the evolution, and it's fully compliant with the distribution in the following budget chapters. You may note that some of these expenses in the fund are inferior to the expenses in 2026 because the resource mobilization work by the teams is still underway. So it's still underway. This explains the gap between the 26 and 25 figures. The distribution of expenses per chapter is consistent with the previous years. Let me remind you that it will reflect the estimated budget for the eighth plan, strategic plan. So the organization under this plan is fully committed, and this allows us to maintain our efforts with reinforced determination. So it's consolidated per chapter. So estimated figures for 2027 are mostly centered on expenses per budget chapter. Operations remain our main share of expenses, with reinforcement compared to the year 25 and 26 with regard to institutional governance and efforts made by the GRC. So estimated expenses for regions and sub-regions remain quite low, and we'd like to give them additional support and offer a reinforced budget capacity. So this resolution submitted to your approval is about the general budget. So for the general budget, this is the following conclusions. The estimated budget is aligned with the 8th strategic plan. The budget translation of the implementation of the 8th strategic plan is performed with constant staffing levels, with resources reallocation and prioritization of missions. Revenue forecast reflect the activity projections, and we give priority to the 3 pillars of the strategic plan that was presented to you over the morning. So for the budget work program for the year 2027, I'm waiting to answer your questions for this 2027 budgeted work program.
Comments or any questions you may have? No comments from the Assembly? Okay, so we now proceed with the adoption. We have quorum. We will now proceed with adoption of the related resolution. So I propose the Assembly to adopt the resolution number 14 concerning WOAH budgetary income and expenses for the 101st financial year, 1st January to 31st of December 2027. Are there any objections? I see none. Any abstentions? We have 1 abstention, Sweden. No more abstentions. So resolution number 14 is approved by the Assembly. Next resolution is resolution number 15, related to member statutory contributions to WOAH for the 2027 financial year. I propose to the Assembly its adoption. Are there any objections? Are there any abstentions? I have South Africa and Sweden. Okay. No. 2 members. Okay. Resolution number 15 is adopted by the Assembly. Thank you very, very much. And now it's time to have a break. And I ask you please to be here at 5 p.m. Remember that we will have much more to approve, and we will have the elections in the late afternoon. So please remember, we still need quorum in the plenary room. So have a nice break.
you.